All right, so we will get started slowly. I still see the number going up. So welcome to this morning's Provider Support Subcommittee meeting. I'm Deanna Stewart. For those of you that do not know me, I'm the Deputy Director of Community Engagement here at DCYF. We're going to just walk through the virtual meeting protocols, which we're all probably pretty familiar with at this point. Just try to keep yourself muted throughout presentations. If you do have questions, you can put them in the chat, raise your hand down at the bottom of your screen in the reactions button, where you can also, there are going to be opportunities to just unmute and ask questions throughout. If for any reason we hear background noise, we'll try to mute you ourselves, or we might boot you off if we're getting a lot of background noise. So feel free to log back in. If you do have any issues and you're unable to use the chat, you can also email us at dcyf.communityengagement@dcyf.wa.gov, and we will help technically assist you. Let's see, Jessica put the agenda in the chat for today's agenda. So if you have not yet seen it, you can click on that and that will let you know what we're addressing today. We're going to talk through legislative session update. That's a follow-up from last meeting that Nicole Rose and Genevieve Stokes and Katrina Osborne had a conversation with you all and asked for input on our decision packages and the planning for legislative session. We're going to have an early achievers update and then a workforce support update from the early learning division, and then the joint agency integration and inclusion work update following the special webinar that we just had. So introductions. Since we have lower numbers, I'm just going to let people unmute. I won't call you out. So feel free to unmute and just share your name, where you're located, and your role. And we do have an intro question that we'll do after this. So who wants to go first?
I will. This is Sandra Nelson. Our center is located in Southeast Seattle, and I'm the Executive Director.
Thanks, Sandra. Good morning.
Hi, I'm Katrina Brooke. I'm in Woodinville at the Shine School.
Thank you, Katrina.
And I'm just down the road from you. I'm in Redmond, Washington. I'm Hillary Prentice from Sammamish Montessori School. I am an owner, run our school here, and here representing the Pacific Northwest Montessori Association, the Montessori Public Policy Initiative, and kind of coordinating with Washington Federation of Independent Schools.
I'm Julie Schroth. I'm located over in Kitsap County. I own Creative Kids Learning Center.
Morning, everyone. Dieta Simmons, Cultivate Learning, and I'm currently in Seattle.
Good morning. My name is Brian Trimble. I am one of the tri-chairs for provider supports. I'm in Spokane, Washington. I'm the executive director of the Herzog Family Center and owner of that organization too.
Morning, I'm Colleen Condon, also in Spokane, Washington. I am the owner and director of Lilac City Early Learning Center.
Good morning, everyone. I'm Cherie Belt, Director of Operations for Associated Recreation Council, and I am located in Seattle.
Angela Hicks Maxey in Seattle, and I am the CEO of Tiny Tots Development Center.
All right, I see a lot of people putting their intros in the chat as well. So those of you who have not introed verbally, I see Vicki Greger, Spokane Child Development Center in Spokane Valley. I see they're multitasking. Thanks, Vicki. Gloria, welcome, Gloria from Wenatchee. Rochelle, she's owner director Foundations of Faith Children's Academy in Lacey. Sherry, I saw her you mentioned. Carol Morris, you're in Lakewood, early childhood educator, home-based daycare owner. Welcome, Carol. Dee Hirsch, welcome. She's in Seattle, Director Discovery Montessori School. And let's see, Sarah from We Care Academy in Linwood. Anyone else who has not introduced themselves yet? And James Watson, Loving Kindness Child Care Learning Center in Tacoma. Any of the staff would like to unmute and introduce themselves?
Hi, everybody. I'm Amy Russell. I'm here in Olympia. I am with the Department of Children, Youth, and Families in our Early Learning Division. Nice to see you all today.
Thanks, Amy. Go ahead, Jessica.
Hi, everyone. I'm Jessica Hertline. I'm with the DCYF Community Engagement Team, and I'm here providing tech support today.
Good morning, everyone. My name is Erin Kerrigan. I am the Community Engagement Administrator here at DCYF, located in Seattle at the moment. Good morning, everyone. Thanks for joining.
All right, Susan Brown, welcome. Susan is from Seattle, CEO of Kids Co. Let's see, have we missed anybody? All right. Yes, Amy, we have a lot of thunder and rain here as well. And my lights just flickered. So hopefully nothing goes out. All right, so we're going to do an introduction question. And the link will be in the chat. The question is there anything you are hoping to accomplish, personal or professional, before the start of the new school season? Thanks for putting the link in the chat, Jessica. You guys can just click on that and then answer the question. It should pop up on the screen. So hiring enough staff, I don't think that's going to be unique to one. Read more books. So Erin and I are book junkies, and we always love a good book recommendation. So if you want to put those in the chat, feel free to do so throughout today's meeting. And hole in one, I can only guess who said that. Well, I love the relaxation ones and time with family. All right, so continue putting them in there. We'll be sharing the, oh, actually, Jessica, can you scroll down? Oh, they're all up, okay. So vacations, those are the ones that were just added. All right, so we're gonna go to the next slide. We'll be reviewing the meeting minutes from the last meeting and the feedback loop. And Jessica's gonna put those links in the chat or the documents. So if you click on the document, the meeting minutes and the feedback loop, if you wanna take a few minutes just to review both of them and let me know if you have any questions. So we'll probably pause for a few minutes here, just so you have time to look over both documents. All right, so does anyone have any questions about either of those two documents? All right, so the next document is the agency updates, the DCYF updates, and I know Jessica's going to put that in the chat. Feel free to click on that and look that over and see if you have any questions on that document. That'll be the last one we do this for, so. And if you do have any questions that come up for the minutes or the feedback loop, feel free to unmute.
So the document that was sent out, I didn't click on the ones in the chat just because it says I have to download them, but it was sent out in the email. And I'm reading the one that, what does it say? It says discussion, questions, feedback from June 1st meeting. And somewhere in here, it talks about how family homes are paid for 1 unit for each month. And then the DCYF response is that they're working to change centers to that same kind of billing structure. So I think it's really important to read through this since there were so many questions raised in that meeting, and it looks like all the responses are in here. It's hard to get, in the meeting, we hear a lot of, we'll get back to you, we'll get back to you. And they did. It's just, we have to take the time to read it. And it's a long document.
Yeah, it's a good point, Julie. So that's typically what we develop the feedback loop doc for, is to follow up on those questions that we hear from you during the meetings where, maybe a presenter doesn't have the answer right away. And if we can't get it from them really quickly to turn it around in the follow-up email, then we'll put it in the feedback loop just so we can close that that Q&A out from the last meeting. So we won't, bury it in the minutes. We'll definitely try to call it out in the feedback loop document. But sometimes they're lengthy, so it's not easy.
A lot of these things are something that you haven't completed yet, right? It's stuff that is on the radar that still needs additional work, such as the background check issue, which we have a reprieve from, which is fantastic, but the work's not done, right?
Right.
Yeah, speaking of background checks, we did hear that, Yakima's been without a background check vendor for quite some time, and they've had to drive a really long way. And then I heard on an ELA meeting that they were going to be rectifying that within a couple of weeks. These areas, there shouldn't be background check deserts where you have to expect a new employee to drive for a couple hours, just one. I mean, it's insane. So I would love to know if they got that opened, but
I guess piggybacking on that too, looking at it at the Identigo locations, there were quite a number of locations for Identigo that do not provide DCYF fingerprint background check. They provide TCA. TSA, that's what I was looking for.
Yeah.
And I believe possibly firearm fingerprints, but not DCYF fingerprinting. I'm curious as to why we wouldn't universally be able to have access, if they have that equipment, to be able to process it at all those locations, so that would really help to make it more available. Certainly it's not going to solve the problem in some of our more rural communities. We really need to focus some effort over there. But that might help broaden it.
Deanna, if it's helpful, I have an answer about the Yakima IDEMIA location.
Yeah.
And it looks like they will be adding it. It'll be, I think, in the Nob Hill area, starting August 25th, a permanent, like a fixed site, permanent location. And the background check unit is looking at ways to provide more regular communications about openings, like closures, new sites, et cetera, from IDEMIA, so that providers have a better sense of like if things are coming online or if they're closing. So the background check unit is working with our communication shop and the vendor to figure out how to more proactively communicate about openings and closures. But the Yakima one is coming online.
Thanks for sharing that in the moment.
Just a small teeny tiny tidbit relating back to background checks too and communication is I've had staff indicate that they had a background check, went to a location, and no one was there to be able to do background checks. And then they were told by somebody, oh, we don't do that here. And then they remade an appointment and it was at the same location and they got background checks the next week. So I think there's a little bit of in identico, some miscommunication and misunderstanding and that kind of thing that maybe we could smooth out.
Thank you, Hillary. I'll take that feedback back.
All right, any other comments or questions about any of the documents so far?
I mean, I'm still reading it, but it's really lengthy, but it is a little frustrating to see so many comments about like hiring requirements, professional development standards, all the training service, in-service trainings or pre-service trainings. And, you know, that's a barrier. And then just the standard line of go to the PD page and you can get your answers. And there's, I mean, providers are saying it's too much, but there's no relief for that.
Thanks, Julie.
I did want to say one kudos area that I think had happened. I heard kind of through the grapevine through my staff that it sounds like for international degrees, now you can just provide the transcripts without having the articulation, and DCYF is taking on, Merit's taking on the articulation part of that. Is that an accurate interpretation or is there something else going on that we should be aware of?
Hillary, I'm happy to double check on that and get back to the group.
Thanks, Nicole. So any other comments or questions? And I know, like Julie said, I know there's a lot of information. So if you have a question or comment throughout, feel free to send that in the chat directly to Erin or myself throughout the meeting, and we'll still address it during the meeting if it comes up. All right, I'm going to turn it over to Brian. Oh, sorry, did I just cut someone off? Okay, well, Brian, you are up.
Excellent. Thank you very much, Deanna. Again, thank you everyone for coming today. My name is Brian Trimble. I'm one of the tri-chairs for provider supports, and I'm excited to be here this morning again and have the opportunity to collaborate and share our perspectives and learn from each other. My guest today, somebody we've worked with in the past a lot, and a pleasure to introduce Nicole Rose, the DCYF Assistant Secretary of Early Learning, and a Government Affairs Advisor, Genevieve Stokes. And I don't know if, did Katrina join us?
No, I think that was a typo.
Totally fine. I just wanted to make sure. I didn't see her on the list, but I wanted to make sure. Yeah, I didn't want to introduce her and she's not here. So with that being said, today's opportunity to talk about the feedback for the proposed 2023 decision packages. So Nicole, welcome, and I'd like to start you off.
Yeah, thanks, Brian, and good morning, everyone. Happy to be here today to talk about what we were able to incorporate in the decision packages and some of the things that we weren't able to incorporate and why. And it sounds like folks are still reviewing the long document that had all of the individual responses and what we were able to do. So I'm just looking forward to sharing this with you all today. So if we want to go to the next slide. I kind of just talked a little bit about this, about what we're going to incorporate. And then at the end, we'll just talk about next steps in the budget process, just to remind us all about sort of where we're at. We're in the land of drafting decision packages for final leadership review, and I'll have Genevieve talk about the rest of the process as it works for a cabinet level agency. So if we want to go to the next slide. So one of the suggestions that folks had was to allow all providers to bill a consistent fixed rate per month. And so we're saying yes to this in a couple of different ways here. And so one is something that we're trying to do outside of a decision package of really transitioning licensed centers to a monthly unit. Because we really think that simplifying the amount of care authorized is one step to doing that, and that will help with a variety of different things. But we are also asking for funding to implement enrollment-based pay, which also simplifies the billing process. And so I just wanted to note that those are two different things though. And so we're trying to do a combination of both. So one is moving to a monthly rate, and then moving to enrollment-based pay. So we want to go to the next slide. We heard a lot from a variety of different groups about eligibility for students taking classes at four-year colleges, and even eligibility for students taking classes at a community and technical college that we're looking at working on a four-year degree. And so based on that feedback from a variety of stakeholders, including this group, we will include that in our decision package. This is background check process, and this is something you all were just talking about. And so there were some immediate things that we're able to do, and then some things that we are looking to do in the decision package process. And I'll talk a little bit about this and then turn to Genevieve to see if there's anything else she wants to add here. So one of the things that we want to do is to continue to waive the background check fees. So that's something that's waived right now, and we want to ask for that to happen permanently. And then you all were just talking about where the offices are located, and even just talking about IDEMIA, you can't do some of the DCYF fingerprints at all of those offices. And so we really want to make accessing background checks easier for providers. And so we're requesting funding to have fingerprint capability in our DCYF field offices. And then the other thing that we're looking at doing, because this is allowed in the Child Care Development Fund, is changing the renewal schedule around background checks from every 3 years to every 5 years. And so trying to really provide some additional supports related to funding relief, and then easing access to where those fingerprint checks can happen, and then also lengthening the timeline around renewals that is allowed within the Child Care Development Fund regulations. And then at a higher state level, I think you all recall, and we're engaged in many conversations around the larger interagency background check work group that's led by OFM, that's really looking across the entire state and state agencies that do background checks. And so we do expect that legislative proposals would come out of that work. And Genevieve, anything else you want to add there?
I would just add that on the having background check fingerprinting capability in DCYF field offices. We are planning on piloting that this fall, hopefully getting started, or at least by the end of the year in a couple offices. I think Aberdeen, I think Yakima is one, and there's one other I'm blanking on. So we are going to try and start testing that out in the hopes that we get the funding to do this and can spread it out statewide. But looking at the places like Yakima that have been affected by closures and trying to make up for some of the capacity there. So trying to bring that online just for a pilot sooner than this DP would be funded. That's it.
Great, thank you. So we can go to the next slide. So this was around a suggestion around making sure if we were doing job search, that there was some level of oversight around how job search was happening. And so we said no to this one because as we look at eligibility, we would look at a 12-month eligibility period when families are approved. And what we're really hoping this policy does is, again, center on the needs for care for that child and family and continuity of care, as well as if a family was authorized, continuity of funding for a provider. And so we think our current eligibility rules will allow us to do this. And we're able to close authorizations when a family is disenrolled. So we think our current eligibility tracking will allow us to do this, and we have some things in place that would allow us to disenroll or close the authorization when a family's disenrolled. Again, really trying to look at continuity of care here. So compensation issues, and I want to acknowledge the compensation issues that are happening in the childcare field right now, and acknowledge that this says no, and we would really like it to be a yes. And I want to tell you why it says no and some of the things that we're really looking at here, and just provide a little context around compensation and what our levers are with compensation. Because we agree that making sure that the true cost of care is paid for is really important. And that includes looking at what are your staffing costs, because that makes up a bulk of the cost of care oftentimes. And so when we think about compensation, there are a couple of levers that we have. And one is making increases to the base subsidy rate so that more dollars could potentially go to staff when that base subsidy rate is increased. The second one, when you think about sort of broadening how we might address compensation issues, is increasing family eligibility so that more families are eligible for subsidy and more providers would potentially be serving families who are eligible for subsidy. And then it goes back to that base compensation rate. And so we acknowledge this is an important issue, and we're working with the Child Care Collaborative Task Force to really look at how we transition what we are learning from the cost of care rate study into a rate model. DCYF is required to submit a rate model that is based on the cost of care and a variety of other factors. And then we are hopeful that the cost of care work that is happening, along with some conversations that are happening being hosted by Child Care Aware around compensation, will really help inform any of the advocacy conversations that happen, or also quite honestly help inform our thinking around the cost of care work as well. So we agree this is an important issue. And right now our levers are the subsidy base rate and thinking about more increasing the family eligibility income limits. So if we want to go to the next slide. So this suggestion was providing resources for education and healthcare to bring people into the field. And we said no on this one because there are a variety of things that are currently happening. And so want to acknowledge that we're really trying to think about what are the pathways to bring people into the field. And I think there's been a lot of advocacy and work around making sure that there is access to healthcare as well. And so we do still have our resources for scholarships through the State Board for Community and Technical Colleges and Child Care Aware. We're also doing our PACE work. And then there are healthcare opportunities available for employees of licensed childcare through the Premium Assistance Program that's operated by the Washington Health Benefit Exchange. And then we do have access to healthcare available for licensed family childcare providers who are serving children who are accessing subsidy through the collective bargaining agreement. So there are some resources out there, and we want to make sure that folks are aware of those resources. We want to go to the next slide. So this was the subsidy rate increase should be more than the 85th percentile. And part of why we said no to this one is because raising to the 85th percentile is already in law. And so we can put that forward as what we would call a maintenance level request. And so we feel like this is a good interim step as we work on the cost of quality care work that is happening. And so we acknowledge that we need to continue to look at rates and really use that cost of care to inform the rate model. Our goal is that we would propose a new rate structure in the 2025 legislative session. One of the things that I would say is that as we talk about developing a new rate structure is that we will want to have conversations with this group and with others, because there are a lot of things to reflect on and look at as we get that cost of care model from the work that's happened with the Child Care Collaborative Task Force. And we want to have a collaborative process as we think about some of those policy decisions around the cost of care model. Okay, so I'm going to have Genevieve walk us through the legislative timeline as a reminder, and then I've seen some of the comments in chat and I will try and address those. And then I have one little walk-on item I want to make sure this group is aware of as well. So Genevieve.
Yeah, thank you, Nicole. So as Nicole mentioned at the beginning, we are sort of hitting the home stretch of finalizing our decision packages to be submitted to the Governor's Fiscal and Policy Office this September. So as you can see on this handy dandy little roadmap, I have put a little "We Are Here." I was trying for the like you're at a mall and the "You Are Here" sign, but I'm not sure if it came through. So we will finalize these, adding in those elements that Nicole mentioned and getting these submitted in September. All agencies have to submit their decision packages in September. Once those are submitted, we will post all of our decision packages online and do a high-level webinar for all of our agency packages. So we will make sure that y'all get the invite to that webinar to just hear what was finally submitted. And then in the fall, the governor's office crunches the numbers because, right, they're taking all of the different agencies' asks and trying to decide what they're going to fund because they don't have enough money to fund everybody's asks together. And one of the key things that they're going to be looking at is in November, we get the quarterly revenue and caseload forecast. So this is the economists' look at how much revenue has been coming in from state taxes. And then they're going to project what they think the revenue is going to be. So that tells us, or it tells the governor, how much money he has to play with, right? So how much money he can spend. And also they have a caseload forecast where they look not just for our agency, but across agencies, how many people are going to be using the services that state agencies provide. And they sort of make some educated guesses. It's more educated than a guess, but we'll call it that. And so that talks about, you know, how much money is coming in and then how much money are we already committed to spend based on what we think the amount of like usage will be. And then from there, the governor can be like, okay, how much, what's the difference? How much money do I have to play with? And so then in December, the governor will propose his budget to the legislature. So he'll submit it and say, legislature, when you get convened, please consider this. At that point, we will do another webinar that says, here's what we're seeing in the governor's budget for DCYF. Then the legislature convenes, they run a bunch of bills that cost a bunch of money, and in the background, folks are working on the budget, and they too are looking for the next quarterly revenue and caseload forecast, because they want the most up-to-date, as real-time as possible information about like spending and revenue. That comes out in February or March. And then the House and the Senate will propose their versions of the budget, which may or may not resemble the governor's budget. When that happens, we will do another webinar that says, here's what we're seeing in the House and Senate budgets. We love doing webinars about budgets, it sounds like. And then the legislature will finalize its budget, which we are, I think, the only or one of the only states in the country that requires in Constitution that the legislature have a balanced budget. So it's always, there's not a lot of like room to just go above what the revenues are. So then in April, the legislative session concludes, we have the final budget, and then we do, everyone could probably guess, another webinar in which we go through what we see in the final budget. Sometimes that webinar is a few weeks delayed after the end of session because it takes us a little while to like comb through and really understand what's in there. And then the new budget takes effect next July 1. The reason I mention all of these webinars is I want to make sure that y'all know that there are multiple places along the way where we will keep y'all informed of sort of the progress of all of these asks that we are talking about, so that y'all can decide how or when you want to engage with the legislative session, even if that's just, making sure you're informed of what things are moving. And so we will also then come back to y'all next spring while all of this is happening and start talking about the 2024 legislative session. So we have some parallel timelines there, but that's where we are right now. Any questions about that timeline and how that works, or how? Lois, yes, good question. I will caveat and answer that as a state agency, I cannot counsel you to advocate for anything in particular, but in general, I would say, as soon as we submit our decision packages is a good time to start going out and talking about what y'all think about those, right, with lawmakers. I will note that a lot of lawmakers are up for re-election in November, which means they're very busy before November. So it can be hard to get time with them, but I think that if you do get time with them in the interim, you usually get more time, right, than you would during session. Most lawmakers do 15-minute constituent meetings during session, but in the interim time period, they have a little bit more time, so you can get a little bit more in depth on those. Yes, Lois, that is the calculation of who you talk to and when and what you say. So I honestly, I wish I could say like there's this one place to plug in, share your thoughts, and then it's good. It is a long haul sort of race here. So all of these points that you see on this this roadmap are critical junctures in which like there are opportunities to iterate on the ideas, but also opportunities to influence the ideas. And obviously you want to do that before the legislature signs its budget. So I don't know if I have a more specific suggestion there. A great question. And yeah, great question. All right, if any other questions come up about the sort of process, I'm here for a minute, but I'll kick it back over to Nicole so that she can share whatever it was that she is going to add on.
Yeah, thank you, Genevieve. And for folks who ask questions in the chat, I tried to answer them or have asked for more information. Just as a reminder on scholarships, when we think about scholarships, folks have to be should be participating in an early achievers site, and we're really looking at state institutions and not necessarily private institutions. So just wanted to put that out there. And then answered the questions around cost of care study and rate model, and just want to further talk about that those are two different things. So Child Care Collaborative Task Force will submit their cost of care study recommendations, and then DCYF will need to put that into a rate model in which we will want to make sure we're getting feedback on. Okay, so I'm going to pivot for a moment and talk a little bit about equity grants, and then we can come back and look at some of the questions in the chat. And I just wanted to give this group an equity grants update because you all were so instrumental along with ELAC in helping us rethink the process and go through the co-design process with us. And so we're greatly appreciative of that. And in the last, I would say, couple of weeks, a couple of things have come up, even as we were going through co-design with our partners. One thing came up that had an unintended impact that once we heard about it and had some conversation about it, wanted to go back and fix what we could there. And I'll just share what it was. And it was through the process, there had been a determination that ECAP sites really needed to apply through their ECAP contractor, even if they were licensed or not licensed, and got some feedback around the impact that was having for folks who maybe had just chosen to become an ECAP contractor and were a licensed provider, and also just from ECAP contractors who are saying, I might not want to apply on behalf of all of my sites because the amount of money I would get would not be enough to go to all of my sites. And so we were able to go back and look at how we could address that. And I'm happy to say that we will be able to open up that equity grants process so that individual sites can apply, licensed, certified, or ECAP sites. And that is who is eligible during this round. And we are working on all of the materials related to that to get that updated for our TA partners to provide that information. And then we will also extend this round of equity grants timeline so that folks have the opportunity to apply. And this means I think that about 400 or 500 more sites are eligible for equity grants. And just as a reminder, it is a competitive process. There's about $1.5 million during this round, and we're happy that we could implement this in this round, and it will be implemented for ongoing rounds. While I said ECAP, I want to note that that does include our early ECAP contractors as well, who are all licensed sites. So just wanted to be able to share an update with this group and really appreciate all of the folks who brought that information forward to our attention and to our team who helped us think through how we could make some swift changes here. The great thing is there's not much updating we need to do to the application. We just want to make sure that our materials are updated so folks know that they are eligible and can apply.
I have a raised hand. Am I able to ask a question?
Absolutely.
So two, one, I do want somebody to follow up on my comment about the play money issue. And the second comment is around the equity grants. If you are a subcontractor and your contractor is trying to pull something together, are you telling them to stop and then each individual group is going to do this, or how's that going to happen? Because some contractors are trying to pull it together for the subcontractor.
Yeah, so we are, when this came to our attention, we'd had only 2 ECAP contractors who had applied, and we have communicated with those ECAP contractors, working closely with our ECAP administrator and ECAP team. So that has been communicated to those groups.
Thank you.
Yeah, and so
And
communication that's going to go out in a couple of days, and it's being translated now. And I realized you had a comment, another comment, and I think Genevieve was about to address that.
yeah, I was just going to say, appreciate the feedback. Thank you.
So one of the things I'll just note as we talk about money, as we looked at our decision packages and asks, is you heard me say maintenance level. And some of the things that you all talked about and we're providing feedback on are what we call policy level. And maintenance level, I would just say, are things that we were already needing to do because it was in law. And so that's why we were really looking at some of those things related to the 85th percentile. And then policy level is where we're asking for some new dollars. And there are significant investments that are needed in childcare, and we have some pretty significant asks in the childcare space as well as the state fund and pre-K space. So just wanted to acknowledge that as we talk about money and funding and are being mindful of the revenue forecast and what those things are telling us. So I want to go back, if I might, to some of the
Nicole?
Yep. Yes.
Susan's got her hand up.
Susan. For some reason,
I changed my picture. That's probably why you can't see me.
like I can't see people in their hands up. I'm sorry.
I'm the little girl in the kimono picture. That's who you. The question that I have is just, from a purely statistical standpoint, if you just look at the license capacity that was like on the chart for the stabilization grants, that's like 167,000 plus kids. But we do know right now participation in subsidy in the working connection subsidy is about 24,000 households. So on a percentage basis, a lot of activity happens related to working connections, the subsidy and early achievers, but what are the benefits to the entire sector related to this package? I get the license, that we're waiving the licensing fees, but most of those things are such small amounts of child care center budgets. And so what I'm curious about is why we're not seeing more. I mean, what percentage of this affects the entire field? And then when will we actually start to see some real new developments in how to impact the entire sector overall? Because there's quite a few centers that don't even accept subsidies. And so those centers will not benefit from some of this work that's being done.
So I think that's a great question, Susan, and that's why, as I was talking earlier about compensation, was trying to focus in on some of the levers that we have with subsidy. Historically, when we think about investments in the childcare sector in the state, licensing has been something that is an investment for all providers, and then all providers can participate in early achievers, but the state and our child care development fund is really focused on those providers that are accepting subsidy, which to your point, when you think about licensed capacity, you talked about the number of families that are accessing subsidy. When we look at families, we multiply that by about 1.8 to get to the number of children. But the investments related to CCDF, with the exception of some of the stabilization and licensing pieces, really have been focused on children and families that receive subsidy, and that's about 43,000 children. And so we really saw with some of the stabilization grants and things like that, that was some significant investments in the private pay sector. And I think it's a larger question around how much is the state subsidizing the industry as a whole. And I think one that we've been grappling with at the agency as well, and is something that we're having ongoing conversation about. The investments in our decision packages are largely focused on families that are accessing subsidy, focusing our investments on some of the most vulnerable children and families.
And just one final thought though, Nicole. We know that some of the research that was done by, P5 strategies related to the needs of families, there was a significant number of families that didn't qualify and still don't, even at the 85th percentile. And so I guess I would emphasize the fact that it's not just about people who can't afford it the most, because there's a lot of people in the middle who also can't afford it. And so I'm just really concerned that we keep chipping away only at the very tip of the iceberg, and we really want to address the full iceberg, everything that's underneath. And that's what I hope to get to.
Yeah, I appreciate that comment, Susan. And I think it's really about where we can invest dollars, and CCDF goes up to 85% of the state median income. And I hear what you're saying about the 85th percentile. And I think we're in a place where there's some balance between federal and state investments. I don't know, Genevieve or others, if there's anything else you want to say there. I think, we're really trying to work on how do we continue to increase eligibility to some of these pieces, but also really trying to maximize our CCDF funding and think about and put policy decisions in front of the legislature around state investments.
Yeah, I'll just say, Susan, I appreciate your comment about not just funding those who need it the most. I think that is the framework that we're operating on as those furthest from opportunity, and those children at highest risk for negative outcomes. And I think what you're talking about is do we and should we shift to making childcare something that is supports the lower middle class. I don't really like those terms, but economically, those groups, and is childcare a public good, as something that is like healthcare, although we're a long way away from healthcare being where it needs to be in terms of a public good, I would argue too. So I think that those are the fundamental questions that we're grappling with as an agency, and knowing that we have levers that our funding levers are tied to the CCDF pot, and other things like that. And we're wanting to grapple with these questions. I think that the state overall has been trying to grapple with them. I think that's why you have the Fair Start for Kids Act, because it wanted to move closer to that public good. And I think a lot of people would say that it's maybe not fast enough or far enough, but I think that you see the state grappling with that. So I think we need to continue to have those conversations. And I think that the compensation group that is being led by or convened by CCA is another great place to have that. And unfortunately, it's looking like the feds have decided, or the Congress has decided not to take that up, although we're all glad about climate change. But they, it looked like they were going to take up that question, and that seems to be stalled. So I just really appreciate that point that you made, Susan.
And I think the other thing I would say all is, as you look at the childcare collaborative task force work and the recommendations that come out of there, I think it would, I think those will be prioritized, and it will be great to hear from you all also. Where do you think we need to be pushing on some of the private business pieces? And we can put those asks out there potentially. And as Genevieve said, we're really working within the bounds of some of our federal dollars and requirements right now. And Lois, I see your hand is up.
Thank you, Nicole. So my question is, from what Genevieve just described, is we need a major paradigm shift in the way that folk look at childcare. And I would think, if nothing else, looking at the media coverage and that type of, and that there is a very clear need for investment in the field. So my question is that paradigm shift needed within the agency, or is that a paradigm shift that needs to happen with our legislators, which then of course would leave it up to the advocates? But I know that a lot of the reps and senators depend on you guys to kind of lead them and direct them, or, because even for your legislative packages, you need someone to sponsor it for you. So, or at least fight the good fight. So my question is, where does that paradigm shift start? And where does DCYF stand behind it, or what needs to be done to move toward that more holistic view of the field?
Yeah, and thanks, Lois, for the question. I would say that the paradigm shift has already started. And I think that's why we're continuing to say things like, let's increase the families that are eligible. What are the other levers? When we talk about compensation, what are the other levers to do that? So I think some of that has already started to happen.
Here's the thing with increasing families that are eligible. If we're at less than market rate, that's not really helping the field. And maybe it'll definitely help families, but it does not help the field. And that a family that, we're sorry to say, we know it may be hard for them to pay, but it's either someone has to pay that 15%, right, difference. And that's assuming that you're even at really at 85% of market. So it's either parents pay it or we eat it. And how do we move past that? And yes, Julie, I'm aware that it does help in some areas, but I'm just thinking bigger than just in a way that we can move this so it really helps everyone, so that, move the conversation so legislators, understand the impact that we need financially to really make this a sustainable field.
Yeah, and Lois, I thank you for saying that about the families piece, right? So it's about rates, it's about other things. And I think you do see some continued shifting there as you look at the Fair Start for Kids Act. And I think that as they're talking about all licensed providers, right? There's investments for all licensed providers. And I think there's a balance between, we're not yet serving all of the eligible children under a certain state median income or federal poverty level. And so I think we're really trying to figure out, where do we make those investments? What does that look like? And acknowledging that there's a broader crisis here around childcare. And I think that everyone is aware of that, and trying to figure out how you prioritize those investments. So I saw Angelia's hand up, and then Brian, and I want to be mindful of time as well.
Okay, I will be brief. What I wanted to say is that I appreciate this conversation, and I think it just, the more honest we are, and Nicole, you were starting to get there toward the end, the more honest we are with, this is what we can do because this is the pot of money and what we have control over, and this pot is around vulnerable children, blah, 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 then it's not leading us down a rabbit hole. Because what the federal government can do versus what Washington State can do are two different things. And I think we get this fall, COVID threw all of us in this one basket where on Zooms, we realized we were all in the same basket. So many of us did not even realize there were private providers out here doing whatever they were doing because we were doing our own thing. But once we all came together, we realized that, well, it doesn't matter what industry or what area you were in, all of us were screwed. We saw the disparities, but now doing this work together, there is only so much this pot of money can do within the rules around this pot. And I think the more honest we can be with that, it may be frustrating to us, but we have to realize that's the limitations of this. And then we can fight to go to the other, because we can't take $10 from this and move it somewhere else if it's not allowed to be moved there. And I think that's what I get confused with a lot of times, is that we cannot do what we can't do. And I think we need to just be honest about that. And if we're waiting for the federal government to rescue us, God help us. But I just want us to be honest with what we can really do and what we can't with the rules around this structure. And you were kind of getting there with, if we're not already helping another pool that people say, well, where's this group of kids being, they're not going to let you move some other money somewhere else until you've satisfied this other piece. And I just think we got to be real with that.
Yeah, I appreciate that. And yeah, I mean, that's in some respects some of the bottom line. We have our Child Care Development Fund dollars, and there are certain things we need to do with that. And there are certain populations that we need to serve there, and there are certain requirements. And the state has made investments on top of that. And to Susan, to your point, some of what you all are asking for are actually things that the state must invest in that we are not necessarily able to do with federal dollars. So I will make a commitment to continue to try to be more clear about what we can and can't do. Because I hear that clarity is extremely helpful. And, you know, I will just say, I hear the need. And so sometimes it is hard to say that's not possible within the dollars that we have. And so I just wanted to say that out loud to you all as well, because I greatly appreciate all that you do. Brian?
Thanks, Nicole. I couldn't agree more with just that last point, and that last sentiment there, is that there's what you're stating is, you know, just naming that perspective. There's only so much money, and how much can we, you know, try to do the best with what we can, you know, and both you and Genevieve are making those points. And I think that, you know, the thing that I hear from Angelina and Lois and even Susan, I like the unified, excuse me, that's good timing. But the unified message across the board that DCYF believes in the expectation that all students need to have access to early learning, and how we're going to get there. We understand it's going to take something massive at the state level to change that perspective. But it would be nice. It's good to hear from DCYF's position that's not naming the limitations of where there's a funding piece, or that, yes, we're going to hit these percentiles. Like, we do believe that this is the mission to make sure we protect all students and give those students the access that they need at the earliest of levels. So I appreciate both those perspectives that everybody's been able to put on there. Primarily, it is nice to hear also that DCYF is interested in looking for a longer term investment in just the industry as a whole, like knowing from a mission statement, because originally, I mean, it's about the minimum licensing standards is what DCYF's position was. And now we're moving into quality of care, and then we want to make sure educational standards. And it's like, I want to hear DCYF is behind the idea that every kid has access to early learning. And once we start with that objective, we can work through all the other components from there. I don't think you've said anything against that. I'm just saying it'd be nice to hear from DCYF leadership that that's their mission. Their goal is to push legislation, push and help legislation understand the amount that's needed, because I'm sure nobody's going to argue the demand for early learning is off the charts and the access to it is limited, regardless of access of your funding that you have, private pay or subsidy. So anyways, thank you so much. Appreciate what you all are sharing, and I love the collaboration.
I'm wondering if one of the things that might be good, and would leave it to the chairs and you all to discuss this, but it's just having a conversation with some of our broader early learning team around our strategic plan as it relates to early learning and some of the work that we're trying to look at as it relates to childcare access and integration of pre-K and all of these services that really make up our ecosystem of early learning, because it does take all providers to make this happen. We do really want every child and family who need access to care to have choice in what their early care and education experience looks like. And we know that we need to work with community and you all to really understand what's working and what isn't. And so I would just offer that as if that's something you all are interested in, that we would be happy to come and do that. And I know that you're going to hear about some of the joint work as it relates to state funded pre-K and some other work today. And all of these things really, again, have to fit together to make this work for you all and for kids and families. So, and I see our early achievers friends are here.
And before we move on, I just want to make sure we do have this scheduled till 10:30. So is there any other questions does anybody have? For Genevieve or Nicole, really appreciate the conversations. Everybody, especially being respectful of the chat and making sure those get in there and those questions have been answered. So thank you for doing that. But any other comments or concerns or questions or clarifications?
Brian, I did want to throw out that one thing that you haven't really seen on these slides is the dollar figures attached to all of this. Know that we are doing the final calculations, and when we have that, we'll send out. I want to say that the early learning asks this year, and Nicole will probably kick me under the table, but I think we're looking somewhere in the ballpark of 600 to 700 million all told. So just scale-wise, in terms of when you add it all together, we're asking for a lot in just straight dollar numbers. But we'll have breakdowns of those dollars of how much each piece is going to cost soon. But just acknowledging that you all haven't seen that yet, and it's coming.
Genevieve, is that additionally to the current investment, or is that with the current 1.2 billion?
That's all new stuff.
All new.
Yeah. Okay. Thank you. Yeah. I know it's just, unfortunately, it's still less than 1.5% of the actual education budget. That's why we're always like, yeah, we want to make sure we keep pushing on that. But thank you for that information. That's actually very important for us to hear. That's good additional funding that can help a lot of people. So thank you, Genevieve. I really appreciate that.
And I'm glad you shared that, Genevieve, because I had almost shared the same thing. And just so folks know, about 150 million or so of that is related to rate increases. And so that final dollar figure may be a little bit higher, and we'll make sure that we circle back on the kind of 3 or 4 main decision packages we have with those dollar figures, and that's, making childcare work for families, childcare accessibility and affordability, our ECAP work, and then our maintenance level request on rate increases.
Brian, you have your hand up. Did you have one more question? Just making sure. Just after you said you were appreciating that we...
Be a little bit better at this, but sorry. Thank you.
No, you're good. You said you appreciated us answering questions, so I was like, I better not skip Brian then.
He's appreciating everything. You gotta keep going with him. He has his hand stand up. So yeah. All right. Is there any other questions? All right. Nicole, Genevieve, thank you so much. Really do appreciate your time on this. I do appreciate the time on this, that you're able to come in today and help us out with these questions. I mean, it looks like now, it looks like Nicole, will you be introducing the early learning group or early achievers, excuse me? Is that correct? Or
I'm happy to introduce them if you would like me to.
oh, sorry, Julie
Is
stepped up,
Ellen-
not you. Sorry.
Is Ellen Zito here?
Oh, there it is.
I know we're a little bit.
Kendall.
Sorry, Nicole, it was not you. I was reading something I was incorrect on my list. So
Well, I didn't know if we wanted to start a little early. If they're not all here, we could certainly.
I think we're okay with Rachel here, but I'll defer to Rachel.
Yeah, I think we're good, Julie.
Okay.
See Dietta's here, and I think that I haven't seen if Sandy's here, but I think she'll be here any moment now if she isn't yet. So we can dive right in. And
Terrific. So, I mean, that changes up the intro a little bit, but we've got Rachel Kendall Brown, who's the QRIS administrator. And then you probably have one of your specialists, Dieta. They're going to be doing an implementation timeline update and then some survey results. So thank you for being here.
well, thanks for having us. We always love being able to come to provider supports and having an opportunity to engage with the group. We do have a team of folks here today. We've got Roxanne Garzone, who is from the DCYF Early Achievers team. Roxanne, you want to give a wave to the crowd? Wow! And then we've got Dieta Simmons from Cultivate Learning at the University of Washington. And soon, I'm scanning the names, I'm scanning the little picture slides. I don't think Sandy's here quite yet, but she will be here soon. So Sandy Maldonado will be joining us from Child Care Bureau of Washington. And then I'm hoping that Jennifer Norris will join us as well. Roxanne, can you send Jennifer a Zoom message just to make sure she's got the link and can join us? So today we have an opportunity to come together to talk about early achievers revisions and the implementation of our revised system, which is really exciting. And then we've got some data to share with you regarding our program profile early adopter process that we engaged in at the beginning of 2022 calendar year. And so we're going to talk through that with you today. And then what I want to have happen is we'll break into some small groups. You'll have somebody that will guide you through a Miro board, which is one of the collaboration tools that we've been using in our early achievers revisions process. You'll have a chance to dig into the data with somebody to kind of guide you with how to use the Miro board and how to navigate around that and take some specific data. And then we will have, we'll leave that Miro open until the end of next week. And you'll have an opportunity to take some more time as you have time to really look at this information and to give us some questions and give your feedback and help us really kind of digest the data that we have received. So that's kind of the plan for today. We've only got about 45 minutes together, so I want to make sure that we're really maximizing that time. There's Jennifer Norris, she's on our Early Achievers team. Jennifer, give the wave to the crowd. So I'm just going to dive right in this morning. Before the meeting, you actually received an attachment, which is one of the documents that is embedded in our Miro board. And it is the post-program profile provider survey. Try saying that 5 times fast. I don't know how many times I've tripped over that. We need like a catchy name, like the P4S or something. I don't know. We're all about acronyms in early learning, so I'm sure we'll come up with something sometime. But anyhow, we shared that with you to give you a sense of like, what was the perception that people had of the program profile? But I want to back up for just a hot second because I want to share my screen. Let's see. I think I can do this. I know I can. I know I can. Share screen, pick the right one, and share. So now I can see your faces, but I can't see my controls, but it's going to be okay. We're going to manage. We're going to manage together. We're going to make this work. I'm going to zoom in. So brace yourself for just a second. I'm going to go right over here. And just to give everybody just a refresher about what we're talking about with early achievers. So early achievers, we've spent the last, gosh, I guess it's a little over 2 years now, working on a redesign. So we spent calendar year 2020, once COVID hit, we spent the rest of that year really working with our partners and with providers and coaches and other key stakeholders and partners to really figure out what has the feedback that we've received over the years, what have we learned from that? How can we make early achievers better, knowing that we're in the middle of a global pandemic and we can't be sending out a team to observe in classrooms or in family child care homes, and coaches can't be sitting next to a provider doing coaching in that shoulder to shoulder setting. So what do we do about that? So we got some really great ideas and we put that together, and here is where we landed. And I've shared this with you before, but I think it's worth repeating because not everybody has started into this process, and so it's still new. So our quality recognition cycle, we are no longer calling us a quality rating and improvement system, but a quality recognition and improvement system to really acknowledge the work that providers are doing.
Rachel, can you make that bigger? Can you just?
Yes, I can.
Okay.
Is that better?
Thank you.
You're welcome. And you'll have access to this. I'll give you the link in just a moment so you can tool around with it. But providers start here, they enroll and they'll get connected with a coach right away. And the first step is what we're going to focus on today is this program profile. The program profile is a 360 interview that programs will participate in. So if it's a child care center, it would be the center director, lead teaching staff, and then families have an opportunity to participate in this as well. And we've got the questions are embedded in this Miro board too, so you can review those. They're also on our Early Achievers website. And so it's a series of questions really getting at the heart of what are the values of each of these early learning programs? What are the processes and the practices that these folks have in place, and where are they interested in receiving additional support? As well as collecting some demographic information, which helps sites really understand like, okay, here's who we have, how are we serving the children and families? Are there additional things that we could be doing to support them? And it also helps us at the state to really think about the same kinds of questions. Do we have the right resources in place? Are we addressing the language needs of the providers that are in the system? You know, how might we learn, you know, what are we learning from the data, and how can we do better to advance equity in within early achievers? So that's how we use that demographic data, which comes in a report. And I believe we've shared a draft report with you before. Happy to send out another one and happy to embed it in this Miro board too, so you can review it. Then folks engage in coaching. And then after coaching, they have the opportunity to complete their first video highlight. And really this video highlight piece is part of that coaching process. You know, folks are engaging with their coach virtually, they're engaging with their coach in person if they're comfortable with that. But the videos are an opportunity to capture a moment, you know, capture 10 to 15 minutes of a teacher either facilitating an activity or, you know, just a natural interaction that's happening between kids and a teacher in maybe a play environment. And that those videos get uploaded and we review that using a rubric that's called the Quick Tool, which we've also shared with you. And so that's really grounded in best practice. We've taken and completed an incredible literature review looking at how to assess quality using video, and have taken parts of the classroom assessment scoring system, parts of the ERS, parts of the Love It Way approach that came out of the British Columbia, the Aboriginal Head Start of British Columbia, looked at different kinds of ways and different tools that have been used historically to measure quality, and looked at how we build a rubric in that. And then key elements of this are it's grounded in our Washington State Early Learning and Development Guidelines and our Washington State Core Competencies for Early Learning and Childcare Professionals. And so that or early learning school age professionals, excuse me. And so that gives us an opportunity to really ground our quality practices in how Washington has defined quality. And so that's a really great opportunity for us. Then folks are going to engage in coaching when they get that feedback back. They're going to get a report, and we just started sending out our first reports because we're in the video highlights early adopter phase. And then they'll do the video highlights again. They'll get another report. And then here they can choose, because at this point, a site will have earned enough points. They can choose to finalize their quality level at a level 3, or they can continue on. And we've got this menu of items down here where people can earn additional points through national accreditation, through records review, professional development, doing a school age video highlight, or completing additional video highlights. So we have a whole menu of options. But right now we are to this place right here in our early adopters. And so we haven't gotten to all these other pieces yet, but that's coming. Julie, I see you have a question.
Yeah, I think a lot of people are wondering what the timeline is for people that were due for their re-rate during COVID sometime in the last 2 years. Concerned about losing subsidy eligibility and, just everything to do with that being behind now.
Yeah, that's a great question, Julie, and I'm sure that's a concern that many providers have because we have more than 2,000 providers in our quality recognition queue right now. But the great thing is the way that we designed the system, although there's a backup, right? We've got lots of people waiting and we're just getting started and it's a new process. So there's, things to iron out as we go. The great thing is that providers really have the power in their hands to maintain their subsidy eligibility, because as soon as they submit that request for quality recognition, so anybody that's been sitting in the queue since 2019, 2019, we've got folks who've been waiting because of COVID. They're still safe. Their subsidy eligibility is maintained because they're in the queue and they're waiting for their quality recognition. They've done the part that they can do, and now it's up to us to really work through the providers that are in the queue. So as long as they remain in the queue, and when it's their turn, that they're ready, and if they're not, they have an opportunity to do one deferment so that they'll go to the bottom of the list, and then when they come back up to the top again, then it'll be their turn. So we're really trying to be as flexible as possible, knowing that life is a little unpredictable for folks still now. And so we want to make sure that we have some flexibility while also maintaining some clarity around expectations too.
Okay, one other question about visits. Are the people that come out, the UW folks or whatever, are any of them coming out anymore? And
no.
Okay, nobody's coming out.
So that's the other thing about early achievers, and I'm sorry I didn't make that clear, but in our revisions, we did move to a fully virtual system. And so, as providers are completing this program profile, there are options, there are ways to do it. They can do it through a phone interview where they're actually speaking with somebody that guides them through the questions and inputs that information, or they can access a self-serve survey through a link and complete it that way. The video highlights are being submitted through CC, which used to be called Coaching Companion, and we have supports along the way to help them do this. And then providers are engaging with their coach, sometimes through CC, and sometimes depending upon provider desire and comfortability, they may be engaging in coaching face-to-face as well. But it was really important for us to be able to develop a system that could operate in a pandemic, to be able to continue to offer supports to folks, like make sure that they have an opportunity to connect with a coach, that they can still focus on their quality of their practice and have feedback, and really just continuing to do the best that they can to serve children and families. And so that's why we moved to this virtual process. We do have an exception process. So anybody that does not, that doesn't allow video, let's say, that part of their program values are that they did not do video, that they did not allow that type of technology in their program, or if there's another cultural reason, we have we have an exception process, and so we can send out somebody to do a live observation to complete the video highlight components. So it was really important to make sure that there was a way that everybody could still participate. If that is not, if the value or that particular policy doesn't exist in your program, let me restate that. If that policy does not exist in your program, then, and you just have a struggle with completing a video, we do have supports for that. So we have a lending library with materials that providers can record videos that do not require Wi-Fi, and that we can support the upload process into CC for providers. So that is happening through Cultivate Learning at the University of Washington. And there's additional technical assistance that folks can get with the managing the technology pieces and really helping people build those skills. And it's been really great to see. We've had a tremendous increase in engagement actually in just the revisions process, being able to do things virtually through Zoom and using collaborative boards like Miraboard. We've gotten a lot more interaction from the provider community than we have historically, which has been great. But I do recognize that there are folks that do have real barriers with regard to access to technology. So we do want to make sure that we have ways to address that. Yes, Angelia.
I just wanted to acknowledge that I think that that is absolutely fabulous, and it's already taken my anxiety level way down just hearing you say that, because COVID is still here, and we're all trying to do what we can to keep ourselves safe. And my staff have had it a couple of times, and they're just leery of introducing new things. So, yeah. and Zoom has made all of our lives way more better. I mean, it's sad that we have to be kind of disconnected, but in a large way, I have met so many more providers than I would have ever known if it had not have been for the Zoom technology. So I appreciate you all taking that technology step and saying, let's incorporate it instead of it being a barrier, let's make it an asset. And I just find that to be fascinating. So thank you.
Thank you for the feedback. That's really helpful, Angelia. I'm really sorry about the struggles you've had with your staff. It has definitely been a really difficult several years. Okay. All right, I'm going to move forward here. I'm going to zoom out for a second and move us into just giving you a quick update on kind of where we are timeline-wise. I mentioned we did the early adopters phase of program profile. And so that's the data we're going to look at in just a second. And then, program profile is still continuing on. We're moving forward with the exact process that we started with while we look at this information to help inform how we are going to improve the program profile going forward. So the program profile opened up to all providers in the queue in the spring. And then in June of 2022, we began our next component early adopter phase, which was the early adopters phase for video highlights. So we'll bring you that information later this fiscal year. I'm not sure how long it's going to take us to get the number of programs that we need to, and the number of videos that we need to have a good data set to bring that, but we will be bringing that to you in the future to dig into. And then later this fall, the rest of those menu items that I talked about before, the national accreditation, the records review, the additional video highlights, all of those options will be available later this fall. So as folks finish up their video highlights and are ready to move on to additional components, that option will be available. We do not need to do an early adopter phase for those because those are existing components that we have had in the system. So I think we'll be good to go there. So with that, I'm going to advance us to the next part of our visuals here. So this is what went out in the email to you. I've got to clear my screen here. Even with two screens, there's just not enough screen. I move all these controls. Okay, so I'm going to zoom in a little bit and then I want to show you. So actually, I have shown. Let me
a little more zoom.
Yeah, I'm going to zoom in just a second. I'm going to get a sense of, by a show of an emoji, if you have used Miro board before, throw an emoji up on your, or like a reaction, like a thumbs up or a heart or the celebration something. Not many people. Okay. Okay. All right. Seeing a couple people have some familiarity, some people don't. So this here, what you're looking at is a Miro board, and there are several different, what do I want to say? I'm going to zoom out so you can see there are several different items in here. A Miro board is a lot like a Jamboard, except there's endless possibilities. So we can really load up a lot of information in here. And then it's great because we can capture your feedback directly, and we can encapsulate it as a PDF, and we can save it, and nobody has to go back and transcribe things. So we looked at this quality recognition cycle, we looked at our timeline, and now we're over here and we're going to look at this survey data. And I'm going to walk through this because this is what we sent to you in advance of the meeting. So you have this in a PDF that came in your meeting materials, but it's also embedded in here, and it looks like it's just one page, but maybe I should, hang on, I'm getting ahead of myself. I'm going to send you the link so you all can join me on this adventure. Hang on. Chat, there you are. There you are. Here's the link. So please feel free to join me in the Miro board. This is a collaboration space. So I'm going to zoom in here a little bit. And then, you know what, Deanna, you're so good at giving an orientation to the tools. Would you mind doing a walkthrough of the how-to maneuver? Okay, awesome.
Yes, absolutely, no problem. Okay, so you got your Miro board showing there. And can you hear me?
Yeah, I can stop sharing and you can share your screen. It might be easier.
Cool.
Okay, I'm going to stop sharing. Dietta's going to drive for a minute, and she's going to walk us through the controls because she's done this so many times that she is like a guru at it now.
Would the host please give me the power?
I think I can do that. Look at that.
I'm at the office today, which I don't do very often, so I might be scrambling a little bit too. It is starting to rain in Seattle. Okay, so the first thing as we're figuring this out to know about the Miro board is that you're going to drop sticky notes. There's a spot over to the left where Rachel was kind of getting to that looks like a little sticky note. If you click there, click a color you want, and then you just drop it right in the board and you can type into it. When you break out into your little groups, there will be a leader in each group, and everybody there can give you a little bit more of a tutorial. And one thing Rachel said to us before this meeting was our big goal is to make sure everybody knows how to use the Miro board so that you can come back later on your own, you know, if you're interested to take a deeper look at the information and leave any notes you have. And of course, if it doesn't work for you, you can always send Rachel an email.
Actually, we'll be hosting office hours, so okay. I'll share that information.
You can do it at her office hours. Thank you. Share the screen. All right, let's get everybody out of here. All right, can you see my screen okay? Great. So I was talking to you about the sticky notes. Okay, the first thing I'm going to say is up here at the top, there's this little caret. And if you click on it, you can see everybody's little icons. And if you click it again, it gets rid of them. So it's not as confusing. Were you able to see how I did that? Cool. Okay, great. Just checking because I'm not on my usual computer. All right. And over here is the sticky notes. So you click and then really you can just choose the color you want and drop it right on the board. Of course, it's not going to work for me at this moment. Come on. Oh, there we go. I'm going to delete my sticky note. I made 2 of them. All right. And then I'm going to zoom in. So this first one says, how would you rate your experience completing the program profile? And you can see that 58 people said they were very satisfied, 61 said satisfied, and 4 said dissatisfied. If I have a comment about this, I can just go over here, grab my note, drop it. Okay, if that happens, smaller. Okay, and then another really big key about the zooming is down here in the right corner. If you click on, you can reduce or increase the size here. And a good trick is if you click in the middle, it'll take you back to that 100%. And then a right click lets you drag around the board. And to turn pages, you click on the document. And it might be a little slow right now just because there's quite a few people in here, and you turn the page by clicking this little caret. And so each one of these documents here has multiple pages that you will be able to click through. So maybe everybody give it a try and let us know if you have any quick questions before we go to the breakout rooms.
Will a sticky note follow the page, or will they all sit on page 1?
They will all sit on the top.
Okay.
So you might have to note the page number that you're talking about. That's a good question though. Let's try it. Actually, didn't even think about that. I think it's going to stay there. Okay, green sticky note. Yep, it stays there. So you could put it right up above and note which thing you're talking about. Is probably the best way there. Any other questions? I'm going to stop sharing. Oops.
I think I lost my controls for a second. Where are my Zoom controls?
Miro is really fun. You can get a free account and play with a few boards, even for other things that you're working on. I definitely recommend it. It's a great collaboration tool.
Thank you, Dieta. It has been really helpful for us because it allows us to do things that are a little bit more sophisticated than a Jamboard. Underneath the survey and underneath the other, hang on. Underneath the Jeepers Peepers. There are places where you can stick your sticky notes. We've got some, I observe or I wonder. So if you want to put things in those categories, you can put them there. You can really put them anywhere as long as you make note of what you're referencing, to Dieta's point, like if it's a specific question or if it's a specific page in a document, that will be most helpful for us. What our goal is today is we're going to break into some small groups. You'll have somebody that will serve as a host in your small group to be able to help you navigate through and different sets of these data. So we have, and you're going to have access to all of this because you've got the link, and we'll keep this open. So we've got the coach post-program profile survey where is in here, but the pieces that we're going to look at today are here. This is the teachers survey responses from the program profile from the early adopters. So these are the questions that they answered and how those answers came through. This is the program profile data from family child care owner operator answers. Then we've got another group that's going to take a look at the program profile family interview data. So these are the questions that families answered and how they answered them. And then we'll have another group that will look at the child care center director responses. So we'll have 4 groups today. Each group is going to just look at a specific piece of the data with your host, and they can help you put sticky notes and comments, or you can, of course, do it independently because you have the access to the Miro board. So we'll spend probably about, I'm thinking 10 minutes, because I think we go until 11:15. Is that correct? Agenda masters?
Yeah, that's correct.
Okay, thank you. Okay, so let's spend 15 minutes in the Miro board with your host, and then we'll come back together as a large group, have some takeaways, and I'll share the information about how, if you need additional support, how you can connect with us to do that over the course of the next week. Okay, so somebody from our community engagement team is going to move us into small groups, and then Dieta, Sandy, Jennifer, and I will each host. Roxanne is going to be somebody's co-host somewhere, which is going to be an excellent resource for us. And then, yeah, I'm looking forward to hearing what you think as you look at the data together.
Can I call dibs on having Roxanne be like my co-host?
I love it. I love it.
We're going to be meeting with reviewing the director's responses. So I think that'd be awesome for us to hear.
Awesome. Great. So community engagement folks, if you could drop us into 4 breakout sessions, and then plant Dieta in 1, Sandy in 1, me in 1, and Jennifer in 1, and then put Roxanne with Sandy. That'd be magical.
Perfect. We are all set up to go.
Excellent. Thank you, Jessica. I appreciate it.
You're welcome.
We got to time travel. I don't know why I say time travel, because it's not really time traveling, but I guess we like traveled through a portal or something. I don't know.
Well, we definitely had some movement. We zoomed in and zoomed out, and we're zoomed back. So there you go.
One of these days, I think we'll probably just log in the morning and Zoom will just move us, and we won't have to do any of this clicking links and deciding if we're going to connect through our computer or dial in by phone. It's just going to do it for us.
Absolutely. Rachel, we ran out of time, so no surprise there.
Yeah.
But we had great engagement and people want to know how to connect more. So I did mention that you're doing the office hours, shared the CQI link. So I want to make sure that that's available to everyone. And if you could talk about values in process, I'd love for people to know how they can connect more and inform the process.
Awesome. Thank you, Sandy. Those are all great wonders. So I really appreciate everybody diving in and exploring the Miro. And like Sandy said, we're going to be hosting office hours. I'm going to drop this information into the chat as soon as I find my chat. Here we go. So here comes this. We'll also send this in a follow-up email so you've got it. We'll have a Zoom. You can either call in by phone or you can Zoom in. There's a variety of hours that will be available on multiple days, recognizing that everybody's got different kinds of schedules. And this is your opportunity to just, if you've got questions about what you're looking at, or you just can't figure out how to get into the dang Miro board, or how do you move around it, reach out and we'll make that happen so that you're comfortable accessing the information, because your input is really valuable. We could also consider sending these out in PDFs. I mean, that's something else we could do, and people could write an email back with their feedback if that's something that the group is interested in. Julie, you have a question before I go on.
Yeah, I'm wondering if providers are going to need to know how to use the Miro board in order to do reviews, their early achievers, rating.
No.
Okay, that's actually a relief, because it's a very overwhelming platform for those of us that are not using it every day like you guys are. It was a process for provider supports to like Mentimeter was super easy, and then we had Jamboard introduced to us, and I think a lot of people finally got comfortable with Jamboard. I would advocate that this group should continue to use Jamboard, just because I don't think we should be spending time learning new platforms just in order to provide feedback. It takes a lot of time away from the topics at hand.
I appreciate that feedback, Julie. We will take that under advisement. Given where we are with our mural board, we will have the office hours available so people can pop into the mural, take a look around. If they want some help with navigating that, that is an option. Values and Processes is another group that is really solely focused on early achievers. This is, we've got providers, partners, coaches, and other stakeholders that are involved in that group. And it's much more in the weeds of early achievers and really informing our CQI process. And so they had an opportunity to review this data earlier this summer and have given some feedback on it. And we're bringing it to you to get your feedback on it. And then we're going to take all this back, all the feedback. We'll go back to we have an early achievers data and CQI group where we consume the data and we try to pull themes. We look at it and look at what are the themes that we're hearing and what are the ways that we can improve early achievers based on this feedback that we're hearing. How do we improve the process? We take that to the Values and Processes group, who will then review it, and then they can make recommendations about what they think about those steps and provide additional input, because maybe they've got a different idea than we do. If you are interested in being a part of that group, please include that in your feedback survey for this particular meeting so that the community engagement team can forward that information to us. Or you are welcome to email the QRIS inbox if you're interested as well, which is qris@dcyf.wa.gov. I can drop that in the chat. So I appreciate the feedback that you gave, and we will look for a better way to collect feedback next time, figuring out how we muster through the plethora of data in a way that is most beneficial to your time.
Do we have any last minute question? Oh, Hillary has one. Okay.
Is the rubric posted publicly, or can you provide us with a link? I don't know if it's posted publicly yet. Is it, Deanna?
There is a sample report on CC. I will grab the link now and drop it. So maybe that's not publicly available, but it's in CC.
Great. All right. Well, I do encourage you to continue looking around in the mural, because there is a lot of really great data in there.
We just have a couple minutes before we go to break. There's going to be a Mentimeter before that to provide feedback and comments on the first two topics. Any last minute questions on the early achievers stuff, guys?
Julie, I just want to remind there's a lot of things that get challenging, and just here to remind you, you don't have to do challenging things alone, at least not as it relates to navigating the platforms of early achievers. Reach out anytime. My email's there, our phone number. Rachel and Dieta, we're always happy to help out. So let us know how we can be of support. Thanks, Julie.
Thank you, Sandy. All right, well, great. So it looks like we're going to get the Mentimeter, go to Mentimeter and use the code. Oh, that's different. Okay. So there's our link to use the Mentimeter, and then we will be going on a break until 11:30. But please fill out the Mentimeter first. And remember, this is for both topics. So the legislative updates that we did earlier, and for the early achievers stuff. And when you're done, we'll see you back at 11:30. Okay, hopefully everybody's filled out something on the Mentimeter. Thanks to Rachel and Dieta and the others with EA for coming. I'm taking a break. See you at 11:30.
All right, welcome back. It is 11:30. Go ahead and turn your cameras back on just to remind me that you are all here. Just to give me some sort of pointer before we introduce our next guest speaker. I have almost everyone. Give it about 30 more seconds and then we'll get started. All right, just go ahead and get started on the next portion of our agenda. I'd like to welcome Amy Russell. She is our DCYF's Early Learning Division Deputy, and she's going to provide an overview on a possible option to spend down the remaining stabilization administrative funds and gather feedback on ways to invest that one-time funds to our workforce support. Welcome, Amy.
Thanks, Brian. I think we're just getting the presentation up. There it is. Hi, everyone. It's great to be here today to talk through a possible new opportunity that Brian just said in the intro. I'm excited to be here with you all, and I'm really hoping to hear your suggestions. Let's dive right in. Can we go to the next slide, please? To give you some background information, we estimate between 10 to 12 million in federal stabilization administrative funds are remaining. We have heard you describe challenges you are experiencing that are related to compensation and workforce, and we are exploring additional ways to use these remaining funds to support licensed and certified childcare center and family home providers to maintain their workforce. DCYF is requesting permission from our authorizing environment to offer a workforce retention grant. Providers would use this support to provide one-time payments to their workers in eligible roles. DCYF is developing a plan to spend these funds by making additional investments in the workforce. Can we go to the next slide? Eligibility for this opportunity would include licensed or certified family home providers and child care center staff who work on site. Licensed or certified child care center and family home providers must be open and serving children. This is consistent with CCDF requirements and stabilization grant requirements for workforce funds, so that might sound a little familiar to those who have applied for stabilization grants. Also similar to stabilization grants, the provider would attest to having their workforce data up to date in merit. This is what we would use to confirm the amount of employees. Additionally, DCYF would like to consider making this opportunity open to only those who have received a stabilization grant. That grant is still open. As you know, we extended the timeline and providers are still able to apply. But this is an area where we would want your feedback. Julie, I see you have your hand raised.
Oh, thank you. I was wondering, some of us have people in merit that aren't working for us right now. Like, I do not delete someone if I know that they're going to come back from college the next summer and work for us. So I would hate for it to just go to everybody that's listed in merit.
So that's a great question. I think it's something that we would need to flesh out about the guidelines and the rules for this. I do think that there is an opportunity to reconcile what might be reported in an application versus what might be in merit. So I think this is an area definitely that we would want to explore how to marry that up, the data with the reality, to ensure that we're not providing funds essentially unnecessarily or to a role that it would not be able to be used for. Part of this is the time frame, right? We know that we have a very specific spending obligation and spending timeline. So if you didn't have an employee that would be coming back till like a summer or the next year, that would not be somebody who would likely be eligible for this.
Well, and if they would add a category in merit that says substitute, because I also have a couple of substitutes. I have a few people that worked for me full or part-time in the past, and they sub for us now, so I keep them in merit.
I think we should connect with Angela and others on that, because I thought that substitute was a category. So I think we should look into that.
I guess I need to go and check. I didn't think it was last time I looked.
You may know that better than I, but yeah, we will definitely need to look into that. And I appreciate that, Julie. Thank you. If we could go on to the next slide, trying to check comments too, just to make sure I don't miss anything as we go. I think we have enough time to, to talk through the comments and to answer questions as I'm going through. The licensed provider would apply in Wall Compass. We would want to make the process as simple as possible with check boxes for the answers to yes or no questions, leave some space to confirm workforce information, as Julie and I just discussed, and also attestation or confirmation that their merit information is up to date. Awards would be based on staffing levels identified in merit. So I think we covered that in the previous conversation. And also this is an area where I think that we would want to explore and provide some very specific guidance on how that works. Next slide. Funding amounts. DCYF would divide the amount evenly among total eligible childcare workers across all licensed and certified applicants. What this means is that we will not know the amount per worker until the application closes. So this may feel a little different than past opportunities. And next slide. Resources would include step-by-step application instruction guide, grant overview and guidelines, and frequently asked questions. A lot of this will feel very familiar to past applications or past, I should say, opportunities. Technical assistance will be available and in multiple languages. The target dates would be very short due to the federal spending deadlines. The application would be released late summer, early fall, which feels very much like soon. But definitely we would need to have something out before the end of our federal fiscal year. So more to come on that. Now we would love to hear from you all in provider supports. Some things I'd love to hear is, should we make this grant contingent upon receiving the stabilization grant? Is there other questions or suggestions you have for us? Again, wanting to try to keep this, should we be able to offer this? Keep this as simple as possible, but would love your input here.
This is Susan. I'm just curious the rationale behind saying only though, the reasoning behind not only allowing people who receive the stabilization funds. I'm just curious about that. What difference does that make?
So what we have heard, especially in the past, I would say, 4 or 5 months, or recently, is that a lot of providers say, thank you so much for the stabilization grant. It's incredibly helpful. And we need more. We need to know that we can essentially maintain some of these supports. We've provided pay increases to our workforce, which is a requirement of the stabilization grant. And
what I'm asking is why limit to only those that got the grants? That's the curiosity I'm having. Is it that because there's only $10 million and it'll go further, or?
I think all of the above. It would go further. We definitely want to make sure that if we have other opportunities that are larger, providers are accessing that opportunity as well. Nicole, were you gonna? I thought you unmuted but muted back up. I could be wrong. If you wanted to add something.
And I think, yeah, and so I see some comments coming in. So this is a place where we want to get some feedback, because the initial thinking, as Amy was noting, is that really driving providers to the stabilization grants and spending down those dollars. This is where there's about $360 million for that. We are 97-ish% spent on those. And so really want to drive down that pot of dollars. And so if someone had not yet applied for that, we would want to do that. And what the thinking here is that based, just like King County and City of Seattle did, is we would divide the amount evenly based on the number of eligible staff, and I see comments about eligible staff. So we don't know what that amount could look like, and that really needs to go directly to the staff person. So I think just wanting to make sure we're spending down actually in both areas, both the actual grant amount and the administrative amount.
Lois, your
Oh,
hand.
Nicole. Yeah, thank you. So, I think what might be helpful too is, I'm not sure, Amy, if you could put your the slide back up, I think that might be helpful for us to be able to read through that as we process for this conversation. And the other piece is, I think, looking at the contract that King County and the city had with providers about our responsibility when it comes to these monies might be helpful as you look at ways to put this out. Because the thing is, as Julie shared, we know our staff, we know who's there. Just using merit as your basis may not be the best way to distribute these funds. It might be better just to have us submit the application that simply says how many people we're submitting for. Make it very clear what the amount, what percentage can go toward admin fees, and just go from there. Because I think, excluding substitutes and, putting all these parameters around it just makes it more complicated. If we have 12 staff, or even if we have, like in my case, I have a substitute who just as well be a staff member because I've had to use her so much and feel that her contribution to our providing quality care is just as important to us being able to function as any other staff member. So I think taking out who can't have it, leaving it up to providers to say, who can. And the bottom line is, if they're audited, if DCYF decides to, we have to show how those funds were utilized, and either people are going to pass it or they're not. But I think having more flexibility, taking out some of these stipulations, maybe looking at what happened in Seattle and King County, as well as the agreement that we signed would make this a lot easier for you guys. I also think taking out the requirement that you have to have applied for a stabilization grant. It could be for whatever reason, some boards may have decided they don't want to do that. And it doesn't seem fair for staff to miss out on this money because of the decision the organization made, where this is a little bit cleaner and simpler and goes directly to the folk that have worked. I'm sorry, I know that was long, but I just wanted to share that point or points.
Again, if I could add to that, leaving it up to the providers would also mean that we could do retention bonuses as we see fit for staff that are kind of the stable force at our center. There are people that I have relied on for years and years and years that don't even compare to other folks that have come on in the last 6 months or the last year. They are still making their way. They're still showing growth. It's just not the same.
My wonder and thank you so much, Lois and Julie, for feedback. And this is exactly what we want, is this conversation to happen. My wonder with having a broader spend plan, allowing this to be beyond, like allowing providers to say, this is what I still want to use funds for in these different ways. And then also allowing providers to say, well, some of my employees, they've been with me longer. I want to provide them with some workforce or retention bonus, but not other employees. It creates more of an administrative burden on the provider. And I'm wondering if if that is what we want to do with this, because the goal would be a simple way to provide some relief. So just something to think about there too. The more opportunities to spend in different ways means keeping different and more records. It down the line, if we have to ask them how they spent the funds, things like that. So something to think about as well. Why I could definitely see it both ways, and trying to think about how we make that work or structure it.
Simplicity is great, but it can be demoralizing for staff to know that, wait, I've been here for 15 years and I just got this bonus the same as the girl that was hired 3 months ago. That can be very demoralizing.
Yeah, no, I hear you. I also think that some of our ideas on this is related to what we saw the city of Seattle do. And so maybe it's that I go back and have a conversation to ask,
Yeah, can I speak to that?
Yeah,
Can I
of course.
speak to that? I was a part of the city of Seattle's, and what we decided is that simplicity was best. And so, Julie, to your point, what we decided was that it was easier for us to get a base amount, and that the agency could add on. It didn't preclude you from saying everybody's going to get $400, but if in your agency you wanted to add $200 more because this person had been there longer, you could always go up. And so we were thinking too, what's the simplest way to get these funds out to everybody? And it was an administratively easier way to say, I've got 12 staff, here's the dollar amount, there you go. But it did not preclude me as an agency to say, yes, I've got 6 staff over here that have been here longer. So what I'm going to do is tack on another $100 for them. So that's why we use it that way, is because we were trying to do it as simple and as fast and as administratively easy as possible, versus keeping track why you gave this one that much, The auditing part we thought would be harder. Easier, 12 staff, here's my report. You see, I gave them all $400. Some people got $600, but I at least gave them the $400. See what I'm saying? So that was the thinking behind the Seattle group.
Right. Okay.
Yeah, and if I can,
Oh.
Angie, just to follow up on what Angie was saying too, is that, you do have that 15% administrative piece, Julie. And then for those of us, like Angie said, we either threw it in out of pocket, or you could take out part of decide how you want to use your administrative funds and then give folk extra money using that piece if you wanted to. So there is some flexibility with that.
Right. And this is Sandy Nelson. Also, last caveat was Angie mentioned that we added more money on per agency as we saw fit, because the city in their press release put out a dollar amount that they were giving to the providers. So, everybody knew at least they're going to get this base amount, and then we added on to that. Got it.
And then this is Susan and I'll add just one more comment. The other part of it was there was recognition that every childcare provider who worked in person with kids had the same risk in terms of being present during in-person care during the pandemic. And so we as a group, although there was opposition, some of what you're talking about, Julie did come up in our conversations. We did set a limit of something like, I think it was 6 months you had to be working. So you couldn't have just started in the field. So I don't know if that helps or if we want to do that, but I think that was correct. Like Angie, Sandra, Lois, was it 6 months? I know there was a something.
I can't remember what he said now.
Was it what did we require for the Seattle grants, retention payments for people to work at least 6 months during the pandemic?
Yes.
Yes.
So we did have a length of service requirement.
Hillary, you have your hand raised, and I thought Katrina had her hand raised, but I don't see it up anymore. I just want to make sure that everybody has a chance to chat.
Thank you. I returned a little slightly late, so I'm wondering whether I missed a vital piece of information. Are we talking about the existing grant, or are we talking about future potential?
This is all potential underspend from admin funds.
Okay, because the grant that if we were able to receive something from last year, there wasn't a particular structure of you must spend it in this particular way. It was a list of here are the things that you could apply it to. And
The
the stabilization grant.
Stabilization grant, yeah. It says, tell us how you're going to spend the money. There was a workforce requirement. There was a workforce amount that was separate from the program amount. So there was flexibility and also specific workforce support that happened in that grant. But you're correct, Hillary.
Okay, great. I just wanted to make sure I wasn't missing something there.
Katrina, there you are.
I was wondering if, since everybody's applied and they're extending the application date so more people can apply, if there's money left over, would there be just a way to look at the centers that have already applied and just divvy up that money to those centers that have applied by your next deadline, instead of having a reapply and having it as a retention? Couldn't it be just like an amendment to what we were awarded the first time?
So thank you, Katrina. That's not the first time that suggestion has popped up. The only issue is that because these are taxable funds, we would want to make sure that those who received even more funds than what they recently received through the stabilization grant, that they were aware and wanting them. And who doesn't want money, right? But then I'm thinking there could be unintended consequences. So we also, the administrative burden of sending out payments to 5,000 or so licensed centers and family homes, and then having somebody want to return the money, that makes it really difficult as well. If they say, I never asked for this next amount. So although that does seem like a very simple way, I think from an auditing point of view as well, we need to make sure that they understand if how this would work, and that somebody raises their hand if they really want it, I think.
But you've already got all those people that have applied. Why not send just those people saying, this is the next step, this is what we're going to be, amending it with and adding these funds. Please let us know if you are not wanting to apply for these. I mean, it was a very simple application to apply.
Right. Like an opt-out almost versus an opt-in.
Right.
Yeah.
That's just a suggestion.
Thanks. No, thank you, Katrina. I appreciate that. Nicole, I think you had your hand raised for a second. I don't know if that was on purpose.
It was. So I just want to clarify too, the reason why we have to get approval for this and we can't do, Katrina, immediately just what you suggested along with what Amy talked about, is that these are different. It's a different fund than just the stabilization grants. It's the stabilization admin dollars. And so we have to get approval to use those dollars in a different way. So we can certainly take all of these back, but in the spirit of transparency, I just wanted to clarify, like what you're suggesting, if we had underspent in the stabilization dollars, we could probably just figure out a way to do that if there was agreement about what that looked like. And we just have to get approval from our authorizing environment, which is Office of Financial Management, and the legislature to do something different.
It might be helpful to call it something different then, instead of
so like
lumping it all together, because we've already had a stabilization grant, we've had quality enhancement grant, we've had a retention grant. So keeping track of all of these, keeping track of how the money can be spent and who can qualify for some, who doesn't qualify, it's not just based on being licensed, is starting to get, for me anyway, it's starting to get a bit overwhelming as to how. So I don't know if other directors are feeling that way, but just, I have had to raise staff wages dollars more than what the retention grant, figuring out what we got and how much is going to come to about $1.50. And I have had to raise anywhere from $2 to $6 an hour to get staff, because there aren't staff out there and we are all competing for them. So it just, so that's my 2 cents.
I think you answered your question. You overspent. So if you get audited, don't worry about it, because you spent more than what they gave you. As is most of us, because you're right, the money is gone.
yes, that I believe we all agree that that we've provided support and it all goes quickly into the right places and more support is needed, which is why we're having these conversations. And I really appreciate the feedback. Any other questions, concerns, wonders?
So Amy, this is Sandra Nelson.
Hi, Sandra.
The end of your fiscal year is October, correct?
The federal fiscal year, essentially, it's September 30th.
Oh, September 30th. So it's got to be a really quick turnaround.
Yeah, just to have people raise their hand. This is the application portion. And then as soon as we gather that, then we can still pay them out, but we have to have people raise their hand to apply.
Gotcha. Thank you.
This has all been really helpful for us. I think Nicole will agree that this feedback's been very valuable and a lot to think about. And yeah, I think that we will, I know that we will provide more information when we have it, either in the feedback loop or maybe a follow-up before then, depending on the process, the community engagement process, but we'll let you know.
This is Susan. I would just add that, the timing of everything is really important. So when Seattle did it, it was in the midst of, more in the heat of the moment in terms of everyone in the pandemic being impacted. And I think what I'm hearing, and I agree, is that what we really need is a way to sustain the wages that we've all increased our budgets to, because that's the real challenge at this point, because we've all had to, $3,000 hiring bonuses, quarterly retention bonuses, increased compensation. We're all trying every trick under the sun that we can think of to keep our centers open and attract staff. And it's not working. Kids Co itself, we have 28 vacancies to fill. And there's not much more we can do in terms of increased compensation. So I think that also looking at maybe looking at how it just goes to support what we've already done from a compensation standpoint should be considered also.
Thanks, Susan.
Lois, can you talk a little bit more about the connecting cleared staff from Merit to Compass and what you're hoping could be accomplished by doing that? I just want to make sure I understand.
So I was just thinking about going back up to that who's eligible question, which I know you said you guys were going to consider the feedback on that, Nicole, but as Julie mentioned, that there are some college students that she has that come every year, but they're only there for a few months out of the summer. So being able to connect, like for instance, if you said there's a simple application where we can connect folk, I was thinking that, is it possible for us to put a checkbox back to next to the names of the folk that we're applying for, or that's just one idea, but I still go back to the simplest thing is on the application to be able to say, how many people are you requesting? And, someone just writes in 12 or 13 or 50, whatever it is. So either allowing us the opportunity to check a box next to the person, although to tell the truth, our retention, I'm sorry, I'm thinking in a thought bubble. I feel like Ross right now. I think the difference is folk leave. And then if we say that person's actually going to receive the money, if for some reason they have to quit, then they may not. So, and then we have to fill them with someone else. I'm just thinking it might be simple just to go by the number of people that we say we need the money for in the application and divvy it up that way. And then for folk who want to give people more, they can use their admin piece or just pay out of pocket.
That was helpful. Thank you, Lois. I also I wanted to circle back to what Susan was saying as well. Because I just want to reiterate that these are one-time funds, and so that's why we were looking at a retention grant. But Susan, are you requesting that providers be able to use them in a different way because you're looking to sustain wages? Just because these funds wouldn't be able to sustain what?
Yeah, I get that, Nicole. I was just trying to acknowledge the fact that it's not gonna, even the retention bonus isn't gonna sustain. And I would argue that there's probably childcare teachers who got the Seattle ones that are no longer in the field, but we were glad to give those funds or advocate for those funds because they worked hard and they risked their own health and family's health to be able to provide care services. But we're kind of in a new place in the pandemic from an employer standpoint, and that is that we just can't find people. So yes, I'm in support of retention bonuses or payments to at least reward the people that are still here, knowing and acknowledging the risk is it may not make a difference, but at least they'll get acknowledged for the work that they have done and may encourage them to stay a little longer. But right now, I think all of us are just facing the risk of more and more people leaving the field, not coming back, and being unable to recruit new staff. And that's one of the reasons right now we're working on a childcare specific job fair with the city of Seattle. And they're helping to market it and everything because we're desperately seeking people. So I think the retention payments that you're proposing are fantastic. I think they'll help providers, teachers right now, especially given the increases in the cost of living. But it's, I think at the end of the day, it's more of a nice gesture than any sort of sustainability thing. And I do appreciate it and still think we should move forward with something. Did that help?
Yes, thank you.
Angelia, do you have a comment?
Yeah, I just want to caution that politically, I think that Seattle has done this once, and now they're on the brink of doing it again with Seattle and King County. And I think it just doesn't seem fair that Seattle keeps doing this type of thing, and if nobody else. So if the state does get into this and is able to do something for Wenatchee and Yakima and Graham and those other places, I think it would just be equitable because some of those other municipalities don't have the same type of budgets, so the state would have to backfill. And I just think from an amount of being equitable that it would look nice. So I also feel like it needs to push forward on that realm because Seattle pushed really hard. And then the second go round when Seattle and King County did it again, it was because it was just a nice gesture. And no, it's not going to fix and solve everything, but it is a nice gesture. And sometimes just a little bit of the thought that people think, I want to say thank you to each and every one of you, no matter where you're at in your state of childcare. It just feels good. So I just want to say that I wholeheartedly say to push forward. I think clearly I just want some more money back in my coffers because I've been paying out COVID funds, because I don't think it's fair for staff to have to use up all of their benefits. But if it's between me getting some of that money or it going directly to them, I vote it go directly to them. And we'll just have to fight another round for us.
Thanks all. I really, really appreciate this. I see that there's some comments as well that are very helpful.
Just want to ask, are there any other questions or that like to be raised? I know we're a little ahead of schedule right now.
Hey, Brian, if I may, this is Lois. I just want to make sure what I've got from what Angie was saying is that everybody should have access to these monies, and not saying that Seattle and King County, because our jurisdictions did it for the providers, that we'd be excluded. I just want to put that out there because there is still very much a great need in this area. I'm just glad to be able to see that the state is considering following this model. It's really, really exciting. And yeah, I just want to make sure that that's clear. And I'm hoping that it'll be able to be sent out sooner rather than later.
Thank you, Lois. Yeah, I think our sentiments all agree that the funds need to get out as quick as possible. But again, it's a good acknowledgement that the people in this industry really do need this. And we know it's a small amount, but ultimately it's still an acknowledgement. So Angelia was making that same point. Yeah, I think all agree with that position. So, any other questions or statements? Amy, thank you. Really do appreciate your time on it. Your answers were very good for us. We really do appreciate the time you've taken to give us this direction and also listening to our feedback. It's very, it's part of what this program's always been with provider support. It's having the opportunity to collaborate and then share our positions and hopefully develop some ideas at somewhere in the middle ground where we can try to do this equitably and accessible for everyone. So thank you again.
Yeah, thank you to everybody. I appreciate it. Just thanks for the chance to be here today.
I noticed we're running a little ahead and one of our next presenters isn't here, but Angela Abrams is here. And so I'm wondering if she wants to comment, maybe they could add something in merit for a category for substitutes. Is that something you can, oh, good, you unmuted.
Hi, I apologize. I don't have my video. My computer is kind of doing its thing, but I do have phone. So the wondering is to have something for substitutes in the roles section, like the same way you have a lead teacher, assistant teacher.
Right.
Yeah, that's probably feasible. And I don't know the timeline for that, but it totally is feasible. And so we can definitely look into that as far as timing goes. I did, Julie, if it's okay to see a comment on the chat that I might want to follow up on regarding the challenge of associating people to facilities. It is something that we're looking into, and I apologize if you haven't received a response back. Our system interfaces with other systems, and so it's not technically a merit alone issue, but we do have people working on that, and we know that it's been challenging. So if you have a specific question or person that you're trying to work on, you can feel free to, if you're not getting something right away from the merit inbox and you need something right away, I mean, I'll let you all know. You're welcome to reach out to me. I don't want you ever to feel like you don't have anyone to connect with, but it is something that's a known data challenge right now that we're working through.
Thanks, Angela. I guess I'm also wondering if there could be a category maybe called inactive or something. As I mentioned, I do have college students, usually one on merit, sometimes two, that will come back each summer. In the meantime, while they're away at college, their CPR or something else might lapse, and a licensor could write me up for it, but I'm not going to ask those people to renew it until they're ready to come back to work.
That's a great suggestion, Julie. I feel like I have heard that maybe at some point brought up, and I think it ties into what I was hearing earlier. I jumped on the conversation when people were talking about, I just want to mark the people who are currently here to receive potentially the wage supports. And I think that ties to this in some fashion. How do I know who's actually here and tied to my facility? And maybe they are here full-time, or I don't mean full-time literally, but maybe they're here at this moment or not. And that's something I'll put on my notes to follow up on as well.
Thank you. Well, so thank you, everyone. I think we can I'm just going to ask Karen. I see that you're here. She's one of our presenters for the next piece, doing the updates on the OSPI and DCYF joint collaboration or whatever. They're sending something to the legislature, a report. And there was another presenter, Nicole Parker. Do we need to wait on Nicole? Oh,
Nicole's here, and Samantha and Ryan are here. All of our team is here,
Great.
so I think we can get going.
Great. Well, thanks for being here. And I guess we've already done the introduction. Take it over. Thank you.
Yeah, absolutely. Thank you so much for advancing the slides. So for those who don't know me, my name is Karen Gans, and I am the ECAP administrator. ECAP is our state-funded pre-K, and we have a small birth to 3 pilot called Early ECAP that is also being implemented in the state as well, that we have oversight of. And I'm joined today by some of our partners at OSPI and a staff person from my team. So I'm going to pass it to the staff from my team so they can introduce themselves, and then we'll pass it off to our partners.
Hi there, I'm Nicole Parker, the ECAP assistant administrator working with Karen, and I use she, her pronouns, and I'm joining you today from Spokane. Happy to be here. Why don't I pass it off to Ryan?
Ryan may not be ready, so I'll jump in. My name is Samantha Bowen. I am the new Executive Director of Early Learning at OSPI. Today is day 2 of week 2, so go easy on me. I'll answer what I can. And I am joining you from Walla Walla, Washington, so I'm on the east side of the state. And then with me today will be Ryan. Let's see, she's still on there. Ryan Guzman, from our special education programs. So her Zoom just crashed and she'll be right back with us in a moment. So Karen, I think we're going to turn it over to you. Is that correct?
Yes, that is correct, Samantha. So if we go to the next slide, I'll just let you know that today we are here to talk with you about the joint agency report overview that we are in the final stages of pulling together. And this, within this report, we have 3 priority areas that we have identified that really are the foundation or the pillars and the focus of the report. The first priority area is around family choice and expanding the continuum of services and work with families to provide the best services for their preschool aged child. This is a preschool specific focused report. Priority 2 is around child experience, increasing access to high quality inclusive experiences that offer culturally responsive anti-bias education and meets the individual needs of children and their families. And then priority area 3 is ensuring that robust, skilled, diverse, anti-racist, and culturally responsive programs are bolstered by additional funding, infrastructure, and supports to meet the needs of families and children. The next slide really is just a reminder of the conversations that we've had with ELAC and provider support this year. So you can see we are really at the bottom here, the 6 o'clock place on the wheel around sharing report selection feedback today with all of you. The draft report's due August 31st, with a final report being due to the legislature sometime in November. And you can see that the wheel continues around even after the final report is done, because with the information that we've pulled together, we know that we have many more years of work to continue to fine tune and hone our system in order to be able to have equitable pathways for everyone across our mixed delivery system. And then the final slide that I will share with you today is just a reminder about the legislative proviso wording that both DCYF and OSPI received from the state legislature, directing us to implement this work and collaborate together. So it talks about having us compile a report. The report was due September 1st, but we've asked for an extension as a result of the impacts of COVID and the robust data collection that we pulled together. We are going to be addressing these topics: data collection, data sharing, licensing changes, quality standards, options for community-based and school settings, fiscal modeling, statutory changes needed to achieve administrative efficiencies. And then DCYF specifically is supposed to also include the requirements related to ECAP entitlement in the Fair Start for Kids Act, and OSPI is supposed to include additional supports around inclusive facilities and operations. So we're hoping that you'll see much of that reflected today in the overview of slides that we have pulled together. All right, so I'm going to pass it over to Nicole Parker.
All right, and I'll just pause right here for a second before we launch into the first priority area, and just say that what we're sharing with you today is definitely a draft. That's why we're here to gather additional ideas and feedback, but it has been also built off of feedback already that we've pulled from groups across the system, including ELAC and provider supports, including tribes, school districts, ESDs, ECAP, Head Start. We have gathered a lot of feedback from partners and stakeholders as we've gone along in this work. One thing to remember is that this is going to be a very detailed report, a very lengthy report, and it's going to talk a lot about, what's currently happening, what we recommend, what you all have recommended to help towards this more integrated and inclusive system in the future. So a lot of this will cover a portion or a large portion of the early learning system across the OSPI and DCYF, and a good example of that is the coordinated recruitment and enrollment work that we're doing that spans, many, many partners across the system for 3 to 5 year olds, like Karen shared earlier. And then, we wanted to pull you together we wanted to come here again to share some specific recommendations that we have that might have impacts or have to do with the work that you're doing as providers. And we want you to be able to see this and inform it, because you are the experts in what you're doing, and it impacts your work. So one thing that I also want to make clear is that there will be additional recommendations that come in the report draft. There's just so much. And so we really wanted to kind of share with you some initial thinking around the pieces that might impact you and your work as providers. So with that, I'm going to go ahead and go to the next slide, and we're going to talk about priority area 1. So what you'll see is there's a slide for actions, so things that we're doing right now together and things that we need to continue to do together. And then there will be a slide right after this around recommendations. And by recommendations, what we mean is like what we're recommending either continues or goes to the legislature to fund or something like that. So you'll see that here in a minute. So I'll just go ahead and read some of the pieces on the slide. One of the biggest things that we are talking about is continuing the coordinated recruitment and enrollment statewide meetings. Those have, begun to really take off, and partners are really working pretty well on those action teams that we described last time that we were here with you. And we also want to have some focus on launching the statewide and regional CRE groups. Also something we talked about at ELAC last time that we came, or during the special session. We also, within that action work, we really talk about creating a toolkit for streamlined family engagement, eligibility determination, and choices for families across all the, folks that are engaging in that CRE work with us. We also have talked about convening CCAs and ESDs to explore supports to the coordinated recruitment and enrollment work. And one of the things that we're also, heading towards is creating co-branded, collaborative, and translated communications across early learning programs to, inform family choice, of course. And then, explore how to build on what's already available to provide, real-time data about program options. So there's some that, some things that we could draw upon that exist in systems across the state. Okay. Let me see. I feel like I want to make sure that I have the right version up here. Yeah, I think so this slide looks like we, hang on, I'm gonna pull this up because it looks a little bit different than what I thought. Hang on a second.
While Nicole pulls that up, I'll just say this is a very fluid process, and we sent slides to Erin and Deanna last night, and then we sent different slides this morning. And so this is really on us. We are in the midst of this, and there are lots of changes. There are going to be additional changes based on your feedback today, and we appreciate your patience as we try to make sure that we're sharing the most up-to-date information with you.
And this is the right slide. I just looked at it and I was like, oh, what is it? Okay, I'm on board now. So this piece really speaks to how we're going to recommend this work moves forward. Again, this is the recommendations piece. So we have identified through partnership with you all too that we need funding for the launch of the statewide and regional CRE groups. We need some, we are recommending that there would be some funding to do that. In addition, that there would be funding to scale that co-branded, collaborative, and translated communications across early learning programs. We all have some capacity to do that now, but to do it on the scale that we're thinking, we would need some support there. And then really, exploration of and funding for, that annual data analysis of program need by community. That's the last thing that I just talked about in the action slide. It's really continuing to explore that, what would be possible, and how we would probably need some funding to support that. So I think that is the last piece on priority area 1, family choice recommendations. So I am going to pass it off to Ryan and Samantha.
Actually, I'm wondering if we can pause and go back to the action slide or the recommendation slide and just pause here for a minute and create some space for any questions and comments that people might have as we're going through. We just flew through those. Yeah. And so I think that we want to make sure that everyone understands the terms that are on the slides, and I think what we're meaning by this. So I think to just provide a little bit more context, the coordinated recruitment and enrollment groups, that's work that is currently happening and underway as part of the proviso funding. And it is a joint effort between OSPI and DCYF. And it is an item that we've brought to this group in the past, explaining and talking about the different pieces around that coordinated recruitment and enrollment work. And that work has some recommendations that the providers that's the group that we've talked with you about in the past, where we have like over 120 different providers that are providing feedback to that work and helping us really determine the pathway forward. And there are some main areas of work that have been identified, and there's some really robust thinking that's been happening within that. And what we're saying our recommendation is that we want there to be some funding that's attached to that work so that it can be sustained and that it doesn't end when the proviso funding ends. So that's really what this recommendation is about. The funding to scale co-branded, collaborative, and translated communications. So I think that that's part of us trying to do a better job as between OSPI and DCYF in supporting the early learning field and having families really understand all of the options and choices that exist for them within the mixed delivery system, so that they understand that if they're, a parent working, long hours and they, have their, primary language is Spanish, and they have multiple children who need care, that there could be a family provider who's going to end up being the best match for them. And that the system, we want to be able to create images that help families understand all of the choices that are available to them and the situations that may actually end up meeting their needs the best and decrease their stress. So we're trying to do a better job of helping all of us together figure out how we articulate the complexities of our mixed delivery system and how we get that information out to families so that they can make more informed choices. So I don't know what I missed in the chat here, Nicole. So if you can help catch me up, I can speak to, go ahead. I was just going to say that there was a comment, there's not often much of a process of being selective anymore, and families struggle to find programs with openings, and we'll go to the first place that has openings. So definitely recognize that. Thanks for that comment, Julie. And then the marketing team for this process. And actually, Nicole, before you go on to that, I just want to say that's what we're trying to address with that third bullet. So the third bullet is trying to pull some data together and then try to create a system that that is more co-coordinated around what's available in communities and how communities can leverage what they have. So that's really what that last recommendation is about. It's the beginning, it's a baby step, it's a first step in moving us towards really and truly being able to help families make more informed choices.
So I have the next one, which is who is the marketing team for this process? Because one of my concerns is that many of us know some of this. We're in neighborhoods with each other. And so if a family calls me and I know that a home center is better for them than a childcare center, I have relationship with those home centers that I can say, this is a good place. The reverse, they'll do the same for me. If I think you guys need to make sure that you include us in and don't just market this, because there's some unique niches that happen around neighborhoods. And it'd be best for us to help influence those conversations as this gets ready to be marketed out. It's no difference than, Shell gas station is across the street from Exxon, or Safeway is across the street from Fred Meyer. Healthy competition is good. But if we don't do it the right way, we end up marketing in a negative
manner, and that would be detrimental to the field. So please just make sure that we are a part of some of these concepts. Thanks.
Absolutely, really helpful feedback. Thank you so much for that.
This is Susan. I have a question. When you were mentioning finding a right fit, you know, like someone might have language needs or whatever, are all the options then equally resourced? And is it, I mean, how is it paid for? You know, how do you compete with free over fee based? You know, these are questions that are popping up for me. So I'm just curious, is it actually apples to apples in terms, you know, so, and how is it funded if you're not going into the school-based program, for instance, that can't meet your needs?
Yeah, so, you know, I think that Susan, that will be part of what we're trying to build, is a system that helps families really think through the decision points that they have, and when a copay is worth it in order to have there be decreased stress and a better match culturally, or a better match, you know, with language supports that may be provided with a different provider. And we are definitely also trying to build into different sections of the recommendations of this report, opportunities for greater pair parity, pay parity, and resources across our early learning system as well. Okay, so I want help with the time to make sure that we can cover all the slides. So I don't know if we need to move on to the next slide. While you determine that, Nicole, I'll look at the other questions in the chat.
I'm happy to jump in,
Yeah, I think
Karen. Should we continue on? And then I think we have a time at the end for questions.
Okay, great.
That's not okay. So this priority area 2 is really around child experience. There'll be a lot more detail in the report, but we pulled out a few items that, again, thought may be of most interest to this group and childcare as a whole. So one of the areas in action items is articulating what high quality means across all of our programs serving pre-K age children. So this will really be work between DCYF and OSPI to ensure that any pre-K programs that are offered with the state agencies or licensed providers, we have a set of quality assurances in those areas. Along with that, there'll be some work around developing a crosswalk of resources to increase quality for all programs. And that will be work that I'm sure all of you will inform. There's also a question about curriculum, materials, and assessment with our state programs. And so we're identifying what those developmentally appropriate and high quality curricula might be for the variety of preschool programs. So that's the initial work around the child experience. We also have this last bullet that I'll let Ryan jump in on, which is really expanding access to our existing inclusion supports. So Ryan can speak to some of these inclusionary practices and the efforts that are in place now.
Great, thank you, Sam, and apologies for my untimely departure, as my computer does what computers do in important conversations. But my name is Ryan Guzman. I'm the Early Childhood Special Education Coordinator over at OSPI. So as we're doing this work, we also want to take into consideration the supports for children and families that are navigating systems for medical needs, complex needs that may connect them with school systems to support individual educational programs, IEPs, as they go into our 3 to 5 year old supports under IDEA. So we want to make sure that we're not starting from scratch, but rather starting from where we know good practices are taking place. And over the course of the last 3 to 4 years, we know there's been intentional collaboration between our offices, would say within DCYF, ESIT, OSPI's, special education divisions, but also DCYF, Head Start, ECAP, and our child care aware partners around supporting this population. So really leaning into where there's identified need to ensure that all partners have training, access to training, educational supports in space that is low to no cost, because we realize the challenges that come from working within these systems and with families. So again, just highlighting the last bullet is work in progress, but also identifying needs to ensure that all partners have the skills and supports they need to support our families, because our families don't stay in one spot. Rather, we know they're moving within all of our systems. So I'll stop there, Sam, if we want to move to the next slide.
Okay, so the next area again, and thank you, Nicole, for clarifying. So that work on that previous slide really is embedded in that CRE work group. So that will continue, and that was, as Karen said, we're seeking funding to continue that work regionally with the local early learning system. So the next bullet, it says for the expansion of inclusionary practices, the work is beginning and is not yet fully funded. Ryan, do you want to expand on that action item?
Absolutely. And again, because of the complexities of our mixed delivery system in Washington, we know that funding is coming from multiple agencies. We can't just fund this work from OSPI's standpoint. We can't just fund this from DCYF alone, but rather across our system. So we are doing intentional collaboration and investigation to identify where we can leverage existing funds, or where, just like we said previously, we might need to do a legislative ask to add funding to existing priorities or provisos. But we know that these are priorities that need to be elevated within our respective agencies, and that one alone can't do it all. So we have funding set aside within OSPI to support this. We're doing what we can, but we also know that with our relationships with DCYF, NCCA, Child Care Aware, and more, that we need to see this elevated as a priority to make sure that we're crossing systems with the work that we're doing.
Thank you, Ryan. And sorry, these are our recommendations. So when we share the draft of the report, it is divided into multiple areas. So actions was the prior slide. This is our recommendation. So another recommendation that we thought might be of interest was that we're looking to the legislature to possibly fund a person at each agency, DCYF and OSPI, that provides these specific supports, first around tribes, what tribes are offering, customizing training and technical assistance to the tribes, and then also training and technical assistance to non-tribal partners to provide that culturally and linguistically appropriate services, and then training and technical assistance around rule changes to support traditional foods and alternative health therapies in our state-run programs. So that's a recommendation that we have at this point. And then the final one is providing additional ECLIPSE funding for tribes to address their intergenerational trauma and impacts of the COVID pandemic. So those are the recommendations that rose to the top for this priority area 2. As Karen mentioned, this work is fluid. I have been involved in the work in my local community, but this is new to me at this level, being part of the state agency. So as we read through this, we may find that other priorities rise to the top through our conversation. So we wanted to share these as they look today, but they could change when the draft report comes out. And with that, I think we'll go to priority 3 slides and then jump into the timeline and then answer some questions if that works for the group.
Thanks, Samantha. So early childhood provider actions are listed on this page. The first bullet around expanding technical assistance through CCAs, regional CCAs and regional ESDs regarding braided and layering funding. We really heard in the feedback that we received that this is overwhelming and is a barrier for most providers across the state. And so we lifted this one up as a priority to be able to ensure that we could gather additional data and feedback to be able to determine what changes need to be made so that it isn't so that it's not as complex as it is, and that we can work towards removing the barriers and then provide this technical assistance to help each provider in the state be able to navigate their way through this should they want to have multiple forms of funding at their location. So this hopefully will open it up to have it be easier so that there would be more options of funding that could be available across the early learning system. The second one around the family child care home and small or smaller provider pathways really is something we've talked about before as well. And in our ECAP entitlement work, we know that we are going to need everybody who is within our mixed delivery system to be able to reach ECAP entitlement. And so we want to make sure that we are removing the barriers that are in the way for family home providers and small child care providers that are interested in providing ECAP. And so we are in the process of right now gathering data around that, and we want to expand that so that we have more and more providers, because we need as many providers as are interested and willing to provide ECAP services in order to reach entitlement. This is a pathway, much like our other pathway work that we've engaged in, that I anticipate will develop and change over time based on feedback from family child care home and smaller child care providers. The third bullet really is around ways that we can support the timely renovation for small providers and then family child care home providers around facilities renovations, so that you have the resources that you need to be able to provide inclusive services for children with disabilities, or in order to be able to ensure just in general that your services are as inclusive as they can be. We know that there are some barriers currently through the early learning facilities funding, and so part of this recommendation was lifting up some of what we heard about that to be able to create viable pathways for smaller providers to more readily be able to receive that funding. And then we're in the process right now of identifying foundational professional learning opportunities that might be coordinated and offered regardless of setting. So again, we're trying to break down the walls and think about how do we make sure that we create resources that can be available across our early learning mixed delivery system. This would be trainings, like for example, this could include anti-racist training, anti-bias training, interactions, culturally competent and relevant and sensitive interactions with children and families. There could be a variety of different trainings. Those are just some that are for example. The goal here is really trying to be have there be continuity across the early learning system here with the resources that are available. Yes, we are trying to work to figure out how we can have there be a bridge with clock hours and STARS hours. It was Hillary who asked that. Yeah. So I'm seeing Vicky's asking about the smaller provider feedback piece. That is a work that we have brought to ELAC. We've brought it here to provider supports in the past, where we've brought it to current ECAP providers that are providing those services and getting their expertise around the barriers that they faced when they started services and what would have made it easier for them and more viable for them. We're also, I mean, this is something that we'll continue to do. I think that this is an area where I think that we will be, continuing to think about how we can continue to bring this back to this group and the other groups that I mentioned to really be able to think about what needs to change to create greater access. Yes, we definitely, as part of the report D, we have recommendations embedded within it around increasing scholarship opportunities and supports so that because we know our workforce has been hit really hard across early learning, that we know that there are additional supports that are needed. And so that is also embedded throughout the report. Great, so if we move to the next slide, this really shows you the recommendations. So we want there to be funding for this technical assistance work that has begun, this planning that's begun around braided and layered funding. We want to align with, well, we want to take a step towards alignment to change current policy. So on school district campuses, ECAP contractors sometimes have to move. In fact, very regularly will have to move to a new classroom, sometimes annually, because they can't be counted in the count of full classrooms. And so we have a recommendation here to change this, to have ECAP be in the same category as pre-K special education children. Again, the considering ways to support renovation of small providers and family childcare providers in order to provide more inclusive services, and then explore mini grant funding to remove barriers around facility changes, training, and translation to help everyone across the mixed delivery system be more culturally responsive and inclusive in programming. So I think we should pause and see if there's any questions. I know that there was a question we were going to get back to that Brian asked. I think that now would probably be the best time. And that, Brian, was around requirements and across the programming. So OSPI programming following the same requirements as DCYF programming. And we've talked about this in the past also, where I think part of what we're discovering is that we have duplicative monitoring that's happening in school districts. So there are requirements that school districts have to follow as school districts. And as part of this work, what we are trying to do is we're trying to determine what are the requirements that a school district needs to follow around health and safety for children, and how can we work to make sure that we are not duplicating monitoring. So the goal is, yes, to have the requirements be equitable across the early learning system, and also to have it be individualized so that we can move out of the duplicated monitoring that we know is currently happening. And I see your hands up.
Yeah, I think the concern isn't so much about OSPI and the the early learning world within a public system. It's the concern that it puts the private providers at a disadvantage. That's the bigger concern here. It's about being equitable across the board. If we're worrying about duplication, then have DCYF regulate everything. Because I feel that saying that one organization is going to regulate one while the other one doesn't, do it a different way, I think that's a pretty easy way of saying. I've worked in the school districts for years. I'm not 100% sure what that regulation group looks like. So maybe you can shine a little bit more light on that, because to me, I don't know what the regulatory body that exists within OSPI. I worked in public District 81, Spokane Public Schools. So I'm just curious what that would look like. But my more concern on it is that it's not equitable on the side where the private providers follow one certain set of expectations while OSPI gets to follow a different set of expectations.
Yeah, and I will yield to my partners in OSPI around this after I just say a quick thing here, and that is that you know, and I think I said this last time I was here too. I'm sorry to be so repetitive, but we have you know, we have local control for our school districts in our state. And that creates, it's just a different dynamic that we have to navigate as state agencies as a result of that. And again, Ryan and Samantha can speak much more clearly to that than I can, but that is, I think, at the core of some of the differences here around the regulation components. So I'll pass it off to Samantha and Ryan for anything else that you would want to add there.
Yeah, I'll say this. I think, again, day 2, week 2, so go easy. But, you know, I've been involved in transitional kindergarten. I've been an ECAP administrator. I've been a Head Start director, and I've worked really closely with childcare providers in my community. So my priority right now is first to dispel some myths about TK. So we're working on there's some myths and there's some misconceptions about what TK is and what it isn't. So I'm working on that, and we'll release some of that information and gather feedback on that, and build on our foundational pillars, and who and what it means to offer a transitional kindergarten. It absolutely fits in with this mixed delivery system, and you know, for those families who are unable to access private childcare in some of our communities, or who do not qualify for ECAP or Head Start, this is another avenue for them. And I see as more children and families qualify for ECAP under ECAP expansion, or qualify for Head Start, as Head Start is expanded federally, then TK will look different, you know. And so I think that's a priority, is working on that rulemaking for TK, looking at the rules that are out there, the WACs that are out there that apply to TK, and there will be some alignment with DCYF, but as Karen said, there is local control in school districts. And TK has really evolved to meet the need of those communities that had families that did not have access to other programming. So you guys are part of that conversation as we continue this work. I know today was really focused on the joint report, not necessarily a specific program, but I hope to come back and present to you on transitional kindergarten as we are moving through this rulemaking process, and gain some feedback from you guys around TK specifically.
So this is Ryan, just to jump in. I also think it's important for us to recognize that school districts have an obligation to serve and support children with disabilities who are age 3 to 5. OSPI is overseeing and supporting our school districts in that work. To do this well, we have to collaborate with our community partners. There is a necessity within this work to work together, because what we know is that not every child with a disability is going to qualify for certain programs, whether it is childcare, whether it is ECAP or Head Start. We have to find ways to serve and support all of our children, and that's the intent of this conversation today. If you have a child who has a disability or complex need, they might go into a childcare setting yet not able to stay due to staffing, funding, or complex needs of child. where are we serving it and where are we putting our kids? So we're trying to think beyond where we've been within our current systems because it's not meeting the needs of our children. TK is an option. It is not the only option within our landscape, and we have to walk through these hard conversations to get to a place where we are truly serving every child and family that comes to our door. I just really want to lean into that. School districts have an obligation to serve and support children 3 to 5 who have an IEP. They have to go somewhere. They need to be supported in high quality settings. And right now they're not. 21% of our children with disability have access to programs. That's well over 79% that aren't. And are we complacent with that? I hope not. And that's where some of this is really leaning into how can we serve more and do better. It's easy to lean into one program, but I really encourage you as we think about coordinated recruitment and enrollment that we are thinking about our kids and family and grounding and what is possible beyond what we currently have.
Ryan, I want to address that. I applaud that. I think we do need to approach the kids with disabilities. I have a daughter with disabilities, and I totally agree with that. It still doesn't answer the question that I'm asking about, is the equitable approach for all organizations to fall under a certain regulation, because it does I agree with what you're also stating to the point of equitable access. We want that for kids, but we also want that for providers and families. So we don't want to be in a scenario where we identify the limitations of a system that hasn't been getting the support, then say that we're going to create a whole new program, but we're going to put them at a disadvantage so that we can find an advantage. So I'm not taking away from the fact that I don't believe every single kid deserves access. My daughter happened to have massive access to it because I own an early learning facility. But I also made sure I use the public system. I have a other private organization out of pocket. So I do understand that side of it, but I just don't want to argue saying equitable access without treating it with an equitable way for all parties in the industry. So that's where I'm trying to address you. Thank you for highlighting the things that I do agree with. I completely agree with you. We do need more and we do need better access. But I just don't want to go and say disclaiming the fact that one group has to follow under a certain expectation while another group doesn't. And I understand from the statewide approach, the DCYF approaches the whole state in one way. So why can't we do it the same way with OSPI that does from the whole state approach? I understand each school district has their own other piece too, but maybe that's the whole point of approaching TK, is that we need to change those policies of saying that it's not just universal one way of doing things. We need to start adapting to it. So I thank you for their point, but I just didn't want to discount the part of equitable access.
Thanks, Brian, so much for your comments and your feedback. I think that, one of the things that I'll say is that, in part of this joint agency work, the goal is to, through the coordinated recruitment and enrollment work and that regional work that we talked about, the CCA and ESD regional work, is to really be able to have there be more support so that there can be more of these conversations as we're moving forward. I think that when we face an issue where it requires change in law, those are big barriers. Those are really big barriers, and we face severe limitations. And so part of what we've done is we've tried to say, within the system that we have, what are the ways that we can leverage it in the best ways so that we are serving the most children that we can in our state who are preschool aged, and that we are making sure that we have viable pathways for all our providers. And I know that what we're sharing today isn't going to cover all of it. It's intended to be a starting spot for us, a place where we can begin the work and then convince the legislature that there's really important work that's left to do so that they can continue to fund this, so that we can make sure that we continue to work on this until we really have those viable pathways that we want for everyone, that really are going to feel equitable, that are going to speak to the power differential that we know private providers experience, and really be able to move this work forward in ways that aren't threatening your businesses. So I see we're just about at time here. I know there are more questions and comments, and I think that what we can do is we can work to pull those together and then make sure that we provide some follow-up for all of you. Yes, absolutely, not at the expense. None of us at OSPI or DCYF want this to be at the expense of providers across the system.
And that is addressed in the report. If we go to the report timeline, I'm not sure what DCYF, this is your advisory group, I believe. So the report will be shared with this advisory group, correct? The draft. In the next slide, we show the timeline. But absolutely, the question I saw that came up in the chat was, are there risks to childcare? Called out in the grant, and we do. That is taken into consideration as well. Obviously, in this mixed delivery system, everything that we're doing, childcare is at the forefront. So it is absolutely addressed in the report, and you'll see the links to that research and the recommendations there as well. Do we want to go to the next slide here?
Well,
next.
Also, we absolutely can. We have until 1:15. I'm so sorry. I just apologized in the chat for misremembering the
And we have
amount
time
of
for
time that
questions
we
and
have.
answers coming up.
Yeah.
Yeah.
Well, how about we just go over the report timeline here real quickly, and then we can continue some questions. There's a little bit more space in a slide or two. So let's get through that just to finish that information there. So if we go ahead and go to the next slide, and just keep in mind that this is tentative too. We're doing the best with our capacity to get as all of these drafts into our consultants who are helping us write this and put it together. And so these timelines may adjust a little bit as we are continuing to send in feedback and sections of the report. But currently where we're at right now is that we're in the time period where our consultants are reviewing and compiling a first draft for us to review and for us to also share with partners and stakeholders for review. We anticipate that we should be able to get that next week. And what we would like to do, we think probably it makes most sense to email and share that out with this group. Rather than having another, meeting, but we can definitely talk about that. Once we get that, comments back, we can talk about, the best way to get comments. I think, Erin and Deanna and I talked a little bit about that, so we'll share that in a minute. And then you can see that we're going to have a second draft that incorporates your feedback that we'll be writing and reviewing within the coming weeks after that. And then it's our goal to get the final draft to agency leadership, both at OSPI and DCYF by the end of the month. And then following that, we'll have agency leadership review, and then we'll look at that report again. And then the final step is really getting that report to the legislature at the end of October or the beginning of November. So that's really where we're at in the timeline right now, is that we're waiting for the first draft to be completely compiled. So the pieces that we brought to you today will be embedded in that first draft. And again, it's going to be a pretty large, comprehensive, complex report, but we are hoping to share that with you. So if you go ahead to the next slide, the anticipated report draft review window is next week. And it could be a little bit later than that, as our consultants are working furiously to tie the threads all together and make a comprehensive read. So this is actually a little bit inaccurate. I didn't get a chance to really shift a little bit, but what Deanna and Erin and I talked about too is that we do have some Jamboards, particularly around these recommendations and the priority areas, the named priority areas that are set up. And we will take feedback in those Jam boards for sure. The other way that we can set up to receive feedback is through an email that we can send out the draft to this group and then receive comments back. Although we will have to be, we'll be very clear in the email by when we will need it back so that we can meet that really aggressive timeline that you saw on the previous slide. So those are some ways that we can continue to get feedback from you on the report once we send it, and also the topics that we shared today. If you have any other ideas of how best we can gather feedback in such a short time period, please let us know in the chat, or feel free to unmute and share. And with that, I think I'm just going to go ahead and go to the next slide, which is just more time for questions and answers, feedback, continuing feedback.
Yeah, Gloria's had her hand up for a while. Can we go to Gloria?
Yes, thank
Hi,
you.
Gloria.
I have okay about the special needs kids. I live in a small area in Wenatchee. We have a lot of special needs kids around, and some families have struggled because they don't qualify for working connections. And I understand like it's a policies and requirements, but I think we need to find a different way to work with those kids for those families who have special needs kids, because it's difficult for parents when they don't qualify it's difficult for them to pay, let's say $700, $800 a month for child care for regular child, but for special needs kids, it's impossible for them to pay more than $2,000 for daycare, and they have to be supported by the state. And I don't know how DCYF can open access for them and listen, because if they go through the system reject them because they made an extra cent or extra dollar and they don't qualify. But I think they have to be more like face to face with a person to see and support the family and listen and navigate the system to support these kids to be in the early learning, because sometimes parents stop working because they have to take care of these kids, and also they depend on the system, because if they don't working, they have to apply for the stamps for another benefit, or sometimes they let these vulnerable kids with families, with another people, because they don't have the experience working with special needs, and they start having like suffering trauma or something else. And besides that, that's why I'm requesting advocating for these kids. It's a lot of kids around in the communities that they don't qualify, and parents are having a hard time. And also about the flex funds we apply. I don't know how that is going to be working, but we didn't receive any information if we qualify, if we don't qualify, how is the process. And because sometimes to be a provider and we're working with those many kids, special needs kids, we need an extra staff, extra support. And I'm advocating for the providers who work with a lot of special needs kids, but I'm advocating at the same time for those parents who has the special needs kids and they don't have the right access to the working connections. How we can do better for them and for us.
Yeah, we really thanks so much, Gloria, for what you just shared. I think that are you saying that you applied for the early learning facilities funding in the past? I just want to clarify.
Yes, for the flex funds for the special needs.
So I think maybe the special needs funding. Okay, so
yes.
we'll work to share that with our partners in subsidy. Or I don't know if there's anyone else from DCYF that wants to speak to that topic. I do know that in terms of the families that aren't qualifying for services, I know that part of the work that we're currently doing as an agency is to expand eligibility and access across our programming. because we know that there are families that are just not making it into services that really need the services.
Yes.
Yep.
And also they have a lot of children like they are not evaluated for a psychiatrist or psychologist. It's a 6 months waiting list. And my another concern was before, I think I talked with this team or another team, why DCYF don't hire a psychologist in there to evaluate these kids like they do with adults? And help these parents to evaluate the children and early to receive the services they deserve, because to be in a waiting list and be evaluated is hard for them. It's frustrating for parents too, and for providers too. And I think we have to do something else to support everybody and work together.
Absolutely. I see Ryan, commented in the chat that, I think we're all across the board, we're all hearing about the increased need and the increased impacts for children and families. And I do know that through the Fair Start for Kids Act funding, that there are additional resources that, are currently being developed and created through the professional development team and through, other teams in the early learning division. So we can definitely loop back in the future and make sure that we share some of those resources.
We only have time for a few more questions. I will say, I just appreciate all the providers that have stuck around. This is a hard topic. Providers are not really, this isn't something that benefits us. This is something that works against us. And so it's hard to have, you guys come, and we appreciate, Karen, that you keep coming and you keep answering all of our hard questions. I hope that Samantha will come back. Welcome to your job. But this is hurting businesses, and this is going to likely diminish the provider pool. So it's really concerning. And yeah, expanding eligibility is important, but there really isn't any way to escape some of the consequences that this will have. It's not like they're just pulling kids that are not in early learning programs already. If that were the case, then that would be a whole different thing.
And if I could just add quickly, I don't have a concern at all about expansion of more access for kids. I think we need that regardless. I don't think it's going to negatively impact all businesses. I think it's the necessary component that we need to do. We need to get access for kids. We just want to make sure it's done in a sustainable way and also an equitable way. I want the same regulations for everybody for the same reason that we want regulations. We want safety across the board. I just don't want one group, one school district have one expectation while another school district has a different one. It puts everybody at an unsafe playing field, because also it's not in the benefit of kids. It's not safe that way. So I hope none of the things that I was saying is that I don't believe in access for kids. I actually believe we need as much resources as we possibly can and utilize this as a partnership. We are interested in getting kids access. I serve kids with special needs. My daughter has special needs, and I've seen in the chat, there's multiple organizations out there that try to serve kids with special needs, and ultimately it does come down to a funding resource. So OSBI, we're open and interested in partnering in ideas to have more access for kids with special needs. It's just, it comes down to funding. We want to properly compensate those with the skill sets to be able to work with those students that need that extra attention.
So my hand is up. Am I able to get in there, Julie?
Yeah, go ahead.
Okay.
I'm sorry I didn't see that.
That's okay. I know it's a little brown hand, so it's not, sometimes it blends in. My question to OSPI is, I have twofold. One is, my son works in, he's an IA, and he often reminds me that the child that has a special resource package that is in his school class that he can bring out and be a resource, a one-on-one for that kid, he's paid, the school district is paid extra to make sure that that child has the resources to pull out and have those funds. After school, they come to Tiny Tots with no additional nothing. Just they leave 3 o'clock. They've had an IA with them. Then they just roll over into Tiny Tots and we just do the best we can. Why aren't those federal dollars following that child? So that is my one question. And then my second component is if they can get resource dollars, which I know my daughter had special needs from birth. I had her in Boyer Clinic when she was, 18 months old, all the way through. I fought to get her resources to follow her to the daycare. I followed to say, make sure her occupational therapist and all that stuff, those dollars went there. But that was a long slog hole on my part. Why aren't the federal dollars that are attached to every child that qualifies following them to the child care center? If OSPI can figure it out, why can't we figure it out for us? So that's just my blanket statement. That needs to be justified. It shouldn't start just when they get into OSPI. Ding, automatic federal dollars get to kick in. You qualify for all these title, whatever. You qualified before then, and they should be able to benefit wherever you go. That's why even if a private facility took care of you, those dollars should follow. I'm done.
Thank you. Really appreciate the input as always. These are all issues that we've worked to try and address in the report. We're hopeful that you will see this reflected in, so today we really talked with you about the joint agency report. There's also a companion ECAP entitlement report, and we hope that between the two reports, you'll see some of the issues that you've brought up addressed within the report. And like I said, we'll continue to advocate for additional funding for this so that we can continue to, and I guess regardless of funding, we will work to make sure that we can continue to work on this in ways that feel like we are meeting your needs better.
Okay, so we do need to move on to the next part of our agenda. Thank you again so much to those of you with OSPI and DCYF that came here for this topic. Brian, you want to take over?
And I'm actually going to take over this one from Brian because that's part of the stuff that didn't update on the doc that I sent last night. So since he doesn't have the info, thanks, Brian, for letting me take over. So we have a couple of Mentimeter questions for you guys just to gather some feedback on the meeting. So the first question that you're seeing on the screen is relating to the last two agenda items that we had since the break. And then we'll move on to some questions about the meeting at large. So this is just for the workforce support and the joint agency integration work. So I'll give you a couple minutes.
And remember, if you add a comment to the Mentimeter and then you have another thought, just click on the link again. I do it all the time.
Thank you, Julie. That's always a good reminder.
Once a couple more people are able to complete that one, then we can put the next one in the chat. So if you're still working on this one, you can go ahead and keep working on that one. Just want to be mindful of time. So in another minute or so, we'll move on to the next question. Okay. And then Jessica, do we have the next question? Oh yes, so this is a word cloud. We have a couple word clouds for you guys. So Jessica will throw that link in the chat and oh, sorry, this is not a word cloud. This is a Mentimeter again. So share one or more words describing what you liked about today's meeting. Oh, it is.
Can I just say mine is too long for some reason, but I really loved that Angela jumped on and answered questions that had come up on earlier sections. So
I'll make sure to note that and share that, Julie, because I agree that's always super helpful when we have people available to jump in. As much as we can get done in real time during the meeting, the better we are. So.
I mean, maybe she was there the whole time and I just didn't notice, but
Oh, she's still here. So she heard it. I'll still make a note though, Angela, so the public record shows.
For record reflect. No, thank you.
Yeah.
Time I joined when in that middle point, but thanks, Julian, and thanks for the time.
All right. Do we have another? Oh, I don't want to cut people off if there's still people. All right, it looks like that has slowed down, so we can go to the next one. So the next word cloud is please share one or more words describing what you hope we do differently during the next meeting. So this is more just kind of broad feedback for the community engagement team and the executive committee. I mean, feel free to share anything in here, but what we're really hoping to hear from you guys is if there's things that we can do on our end just to make the general meeting experience better for you guys.
Thanks, Brian. Thank you, Julie, yeah, feel free to follow Julie's lead if you have something that maybe doesn't neatly fit in a word cloud that you want to share. Please utilize the chat. I know the executive committee will verify that we do read all of your feedback and we do review everything that's shared in the chat during the meeting. So that's always a good way to share your thoughts with us. All right, Jessica, is there another one or is that, oh yes, there we go. Next, we just have the reflection poll. Thanks for bearing with us. I know these are a lot of questions at the end of the meeting.
I believe this is the last one.
Okay, that's what my notes say. And Julie, when you say you can't vote, is there something wrong with the link? I'm just seeing that looks like we're not getting a lot of votes on that. We don't have any votes coming through on that one, so.
Yeah, it says the presenter needs to refresh the slide. I thought it was just on my end.
Okay, let me stop share real quick and I'll pull it back up.
Nope.
All right, anybody? And if you're having a hard time with this link, feel free to share your thoughts in the chat. I know that's not anonymous, so if you're not comfortable with that, or if you have any, oh, and Jessica reshared the link. Thanks, Nicole. Thanks so much for
Right,
coming.
but the link just says submit. It doesn't give you an option to choose like 1 through 5 or something.
Okay, it looks like maybe that one might be wonky. So what we can do is we can, we'll include this, this feedback survey, that question in with the follow-up email so that you guys can provide feedback on that. But I know that we've had some drop off as people have to jump off for other meetings and such. So we'll leave it there for now. As a reminder, the next provider supports meeting is scheduled for October 12th. And thanks so much for your time today, you guys. I hope everybody has a good afternoon.
Do you know what time of day yet?
Tentatively scheduled to start at 9 a.m. And then we're asking people to hold till 3 p.m. until we have a final agenda schedule.
Okay, thank you.
All right, thanks all.